So before we start today, this is the first handout. If anybody does not have this, there's more right here. Anybody that came in later, I think this one, you have that one? Okay. Let's just briefly talk about elements of the case and how we approach analyzing a case study. I know everybody in here has varying levels of experience. I'm highlighting some kind of key TCM aspects for those of you that are less familiar with that. All right. So, of course, we're going to be given some information. All right. So the information that we're given typically, this is based on the model that we have, the example case. We're given the patient information and demographics. They're usually their main medical complaint, or their chief complaint is how I usually refer to it. The medical history, and then, based on SOAP notes, subjective information from the patient. And I'm separating this into the associated signs and symptoms, meaning the symptoms that are directly surrounding their chief complaint. And then other signs and symptoms, which would include things that we would normally ask, bowel movement, urination, body temperature, etc., right? The reason that this is important when you're analyzing a case is that you're expected to diagnose their chief complaint, right? Your diagnosis must explain the chief complaint. And often in TCM, we may easily identify the kind of what I'll refer to as like a root pattern, but we don't explain the chief complaint. So, as a TCM practitioner, this is the big difference between all the other CAM modalities. We use a different paradigm of medicine, right? If somebody has a headache and you say, well, your headache's from a kidney deficiency, there's no connection there. Even if you're correct, you want to be able to present it or explain it in such a way that it is explaining the symptoms. So, for example, you have a kidney yin deficiency with kidney and liver yang rising, which is giving you a headache. See the difference? All right. And often I find that, people can, if you've studied enough and read enough, you do identify those major patterns. Anyways, first focus on all the, and this is also how we do it in clinic. Oh, you have a headache. When did it start? What made it better? What makes it worse? What is it like? Where is it? All of these questions that we ask surrounding the chief complaint. And then we go into, okay, how's your bowel movement? How's your urination? Whatever, right? How's your sleeping? And that all gives us important information, but we can kind of group it in this way. And then the objective information in TCM is usually tongue and pulse, but may also include certain biomedical information, for example, blood pressure or something like that. And you are expected to know a certain amount of that. They are likely to have, you're given 3 cases, right? 3 cases. You're likely to have at least one of them that relies on the biomedical information. So whether it's the description of a certain test, muscle testing or something like this, you should know the names of the major tests that would be indicated. Okay. Now, the second section is really what we're filling out. This is for the most part, and you're given all of this information, and then you're expected to be able to interpret it and understand it, right? Know what everything means, and then from that, basically, as if you were a practitioner, give your diagnosis, write your treatment principle, treatment plan out, right? So remember that the diagnosis, a TCM diagnosis, is a combination of the TCM illness and the TCM pattern. So there's really, in our student clinic, we put these as like 2 separate aspects of the diagnosis. identify the illness, all right? Headache, that's actually a TCM illness, right? Or, you know, eczema, for that matter. Or, you know, B syndrome is a TCM illness, which is an arthritic-like syndrome, you know. So sometimes it's often very clear, it's often very connected with their chief complaint. Sometimes it's less clear. Hopefully there wouldn't be too much ambiguity, but I'm thinking of a case, you know, where somebody comes in complaining of palpitations, and you know, and they have insomnia. So which is their illness, right? Sometimes patients have more than one illness in their case. Usually it's the chief complaint, unless they have palpitations, and chest pain is something that's comes later, you know, and then I may diagnose it as chest pain because that's more important. At any rate.
You only have one. I guess somebody had insomnia with palpitations.
Yeah.
Palpitations could be waking up.
Yeah. So, well, I wouldn't say that you can only have one, but you should usually differentiate when because often they the waking up might not bother them and may just be a clinical sign, and then I probably wouldn't include it in the illness unless they really, you know, present it as, yeah, and I'm having difficulty sleeping, you know, and that's, you know, chief complaint number 2 that they're expressing.
Right. Yeah. So you're saying for the exam only
they don't specify anything, but you know, in most situations, I would try to stick to one, you know, one main. But if you see 2 that are clearly listed, then they don't specify that you can only write one.
For the marking scheme, it's impossible because it kind of gives you a sense in terms of.
Okay, so I just checked the most recent version of and this is based on the PanCan, which are really the same though, right? So if you haven't looked through the Pan-Canadian blueprint, which is on the CTCM PAO website, I can put it up later. I just want to, let's get started because I'm going to have time to do stuff while you guys are doing practice cases. If you haven't looked at that, I would read through the entire thing. So it doesn't have what I remember seeing before, which is actual percent, number of points for each section. But it does have some of the marking information. Yeah. Okay. Treatment principle, treatment plan. Everybody's familiar with these elements, right? More or less. So anybody have any questions about these major elements of any of the case studies? Because this is what everything is today is based around, right? If you've looked at the practice example, this is exactly how it's laid out, right? I don't know what that can't see from
I know, but I'm just thinking if it's good for class, then maybe. But you need to know, you know what I'm saying? Maybe it might work.
We're doing tons of these, so you're gonna have a bunch like
okay,
this. Yeah. Okay. So considerations in analyzing the case. Can you guys not talk too much over me? I don't have the energy to talk over people. When you're looking at the information that you're given in a case study, there's a few very common mistakes and things that you want to keep in mind. One, we often see information that is indicating the cause of the illness, all right? Or let's say even the cause of the disharmony. The cause is not always the same as the diagnosis. So this is one of the first kind of mistakes that people make. It's often related to the diagnosis, and it may be part of the diagnosis. But if somebody gets a cold and flu from exposure to cold, it does not mean that they have wind cold necessarily, right? It is indicating the progression. Anybody that is familiar with the 6 stages of disease will know that that cold transforms into heat, right? You know, so in many situations, they may indicate a cause, which is useful information, but it's not a blanket statement about the diagnosis. But still, look for whatever information they give you about what the onset was, what caused the disharmony, all right? The illness itself is one of the, people have a lot of questions about this because they give us this list, right? Really, this is based on the TCM textbooks. The list that they give us is based on the TCM textbooks, which are, on internal medicine, dermatology, gynecology, where they separate the syndromes or into what are really common chief complaints or common disorders, and they group them together, and then we use pattern differentiation. In TCM, these are really this is the step right before case studies, right? This is how we look at cases. If somebody has a headache, we know automatically the 10 different major patterns, or however many there are, that commonly cause headache, which eliminates, the need for us to ask 1,000 questions to the patient. We are asking in a very specific way in order to differentiate based on the illness that they have. So when we run the full pan-Canadian prep, we actually go through those diseases, which you've done with the 52 diseases. So just make sure that you're familiar with what they are and could choose the most appropriate one. Okay? Primary pattern. As soon as we start seeing signs and symptoms, we're looking for the primary pattern, or the main pattern that we're addressing, which is almost always the same as the pattern that is, giving rise to their chief complaint. There's that old saying, don't mistake the tree for, or don't mistake the tree for the forest, right? Which means like looking at something very narrow and not seeing the big picture. Most of the time, the primary pattern in case studies, you think of it like almost like an investigation, or like a legal question. Well, let's look objectively, write out all of their signs and symptoms that correspond with this pattern, and then write out all their signs and symptoms that correspond with this pattern. Well, is there 4 for this one and 3 for this one? Well, then 4 wins. That's that's how you can think of it. Try and be objective about it. Step back, look at the whole picture. Often, you'll see a lot of cases there is only one pattern, right? There's only one grouping of signs and symptoms. However, often you will see signs and symptoms that indicate a secondary pattern, all right? Secondary patterns are likely one of 2 things. So either it is a, let's say, later progression or an effect of the primary pattern. So for example, if somebody has excessive heat in the body, and then they also have 2 signs of yin deficiency, right? But they have like 6 signs of heat, right? Do you diagnose it as yin deficiency? So, and where do we draw that line? Because we know in TCM, this is a progression. This is part of understanding pathogenesis of disease, starting from one, moving into the next. So when you're looking at a case, you have to be able to identify and separate these 2 patterns, and then mouse here, right? And then what I talk about is seeing the relationship between these two. Yeah, and that can keep you from getting thrown off. Does that make sense? Anybody have questions on that? The other common cases where we see these types of two patterns, a primary pattern and a secondary pattern, is in a chronic underlying condition combined with a more acute condition. So very common. So for example,
What would be the main thing then?
yeah, so that's the question. All right. So when somebody has and we see this all the time in clinics, signs and symptoms of a kidney deficiency, right? And then they get a cold and flu, right? Or what if we have, a woman who's going through menopause and has arthritis? All right, so she has signs and symptoms. Well, that's often based on the demographic, an X-year-old female that's this age, and then we see, 2 or 3 signs and symptoms related to that, and then arthritis as the main pattern. So we in TCM we talk about root and branch, and we talk about acute and chronic. So sometimes, usually the term root and branch refers to the pattern and the symptoms. All right, and when we have a chronic and an acute condition, we can consider. But I'm just trying to summarize this. We have to consider the severity of each. So, for example, generally, if somebody has a chronic deficiency and an acute problem, if the deficiency is not too severe, and if it's not directly related to the acute problem being, part of the cause of it, then we can address the acute problem alone. Okay. In many situations, where we can address both together. So, if there's any relationship between the two, or if the patient is weak and we're trying to, for example, clear a drain, we may need to protect that deficiency. It'd be like doing both together. And then in certain situations, which are less common, at least in cases, where the patient has a severe deficiency, so let's say they have, in geriatric bronchitis or something like this, and they have some kind of infection, this is a cold and flu, but you can't use any of these clearing, exterior releasing treatments, right? They don't have enough qi, they're too deficient. We have a need to actually boost up the qi before we can actually get rid of or drain the pathogen. We'll talk about this a little bit more with the excess deficiency and 8 principles. Has a lot to do with your treatment principle and whether or not you have to assess whether or not the patient can handle your treatment principle. If they're too weak to clear an excess, which is likely, maybe the acute pattern. Okay. One of the third case of primary and secondary patterns would be an interconnected pattern. That's based on TCM theory, based on 5-element theory, based on vital substance production. I'll use the example of Guay-Pitang syndrome. Spleen produces blood in TCM, right? Spleen and pancreas produce blood from what? From the food we eat, right? Where is that blood formed? It's formed in the heart. So, the Guay-Pitang syndrome is spleen qi deficiency with heart blood deficiency. You see signs and symptoms of spleen qi deficiency, poor appetite, loose stool, blah, 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 and you see signs and symptoms related to heart blood deficiency. Now, in a general sense, to people that are less experienced or that haven't, really people that haven't studied formulas, these seem like two separate patterns. When you study formulas, you often see this as I describe it, Guay-Pitang syndrome, which is because there's a formula that is designed to do these two things, right? So these three methods, you need to be able to separate your cases in this way. Whenever you see more than one TCM pattern. All right, but let's step back a little bit. Did I miss anything here? All right, so I want to keep moving. So treatment priority. Another consideration when you're looking at a case is what is the treatment priority? So in your diagnosis, when we look at the next section here, when we talk about forming a diagnosis, one of the things that I would speak about is how you write it. You know, do you write the secondary pattern first or the primary pattern first? Usually it's the primary pattern first. Almost like, you know, whatever you say first has the most punch, right? It's the most important part of your diagnosis, and then, okay, and an underlying kidney Qi deficiency, whatever it is. You know, that's the secondary thing that I'm looking at that helps it helps separate the way that you're prioritizing. We should also, you know, consider the acute and chronic nature and treatment priorities. Whenever there's serious conditions, that becomes the treatment priority. And usually, again, I'll say is related to the chief complaint. I mean, patients often know what their the level of severity of their symptoms, and that's what they come in and tell you first in that same way of prioritizing. Okay. And I have treatment priority. This is important. Okay, I have treatment priority in the section of analysis. And the reason is because before I even write a diagnosis, and in student clinic all the time, when I'm seeing students going through this, you know, we put the treatment priority as part of the treatment plan as well. But before you even write a diagnosis, again, step back and look and say, what is the most important aspect about this case? That will help you write your diagnosis. That will help you word it and formulate it. You know, when you're confused, when you're looking at signs and symptoms, you're a little bit confused. I'll give you some examples where, you know, it's not very clear, right? You want to think about it in that way, right? Think about what the priorities are. Okay. In forming a TCM diagnosis, so in actually writing it, it's the first section. I don't want to give you this yet because I'm going to time you to actually do the case, but you know, it's the same format that they have in the example. So, you know, the first thing that is listed here is what's the illness, what's the syndrome, you know, what is your diagnosis? You have to form the diagnosis is generally the first thing you're expected to identify. Doesn't mean it's the first thing you have to write down, and it doesn't mean you can't go back and change it. You don't have that. Don't look for it. You don't have it. Okay? Nobody has it. So in forming a TCM diagnosis, again, in clinical practice, the diagnosis.
Oh, sorry. I thought we already handed that out.
Nobody. Okay. Informing the diagnosis, the treatment plan, and the treatment all have to match up. Okay. Who looked confused right there when I said that? Right? Of course they do. That's the whole point, you know, purpose of forming a diagnosis. When you write your diagnosis, ideally, I would like that your diagnosis can explain every symptom the patient has. All right, and this goes to that idea of a primary and secondary pattern. You may be able to identify the primary pattern. The secondary pattern is a little bit like, oh, why? Well, why do they have this sign and symptom? You know, like, okay, well, if they have damp cold, then why is the coating of their tongue yellow? Right? Or, you know, if they have a yin deficiency, why is their tongue slightly pale, right? So, you know, in these examples, you know, they could have a yin deficiency and or a blood deficiency that is damaging yin. So, you know, you ideally should be able to match to explain all of their signs and symptoms based on the diagnosis, within your diagnosis. Now, I have it written somewhere else, but I will say that there are sometimes red herrings. So sometimes you can't identify the reason for every single thing that's written. I mean, you would assume somebody said last week, well, if it's written, you know, they must have written it for a reason. I mean, we would assume that, but that's not always the case. Sometimes there are red herrings, or sometimes there's like one sign or symptom that is meant to throw you off, right? And so keep that as a possibility. You'll get more experience. The wording of your diagnosis should reflect your treatment priority, but may contain information on patterns that are not a treatment priority. So I'll use the example of palpitations and chest pain. All right, if somebody has chest pain, this is of course a serious condition, right? If we think that that's a severe condition, but they also have signs and symptoms of, let's say, you know, kidney deficiency as a secondary, you know, couple of signs and symptoms. You know, I'm actually not going to treat the kidney deficiency if it's mild at all, right? I'm focusing only on that, treatment priority of chest pain, because that's, it's the most important in that situation. But in my diagnosis, I may include the kidney deficiency as part of the diagnosis, but I will not include it as part of the treatment plan, right? Or it would just be an afterthought of, you know, first doing this in the treatment, and then after that's resolved, I'll then look at the kidney deficiency, you know, whatever that is. So the diagnosis can contain that, but your prescription, your actual treatment may not contain that element. A well-written this is an idea to keep in mind again. A well-written diagnosis, and this is how I evaluate your ability to write a diagnosis. Can your diagnosis allow me to basically prescribe an herbal formula and prescribe points to that patient, right? Is the way that you write your diagnosis good enough for me to choose a treatment as another practitioner without any other information? How many of you think you can do that? Yeah? Okay, we'll see. Okay. Now, the considerations of how that works, I know you don't necessarily know how that works, but for example, you may be able to identify a major pattern. Oh, this is blood deficiency, right? This is headache from blood deficiency, okay? Well, you know that there's, I don't know, 30 points that may be used in blood deficiency. So what organ is primarily being affected? Is it the heart or the liver? Is there spleen involvement? Those questions will further aid in your point selection, right? So, you know, yes, we know that we use spleen 6 for blood deficiency, right? But we can, you know, am I choosing, am I using heart 7 or not, right? Which can also be used for, you know, major point for heart blood deficiency. If the way that you write your diagnosis is clear enough, then I should be able to choose based on that. Same thing with herbs. I know not every. Can I get another show of hands? Is it herb TCMP or just acupuncture? Anybody TCMP besides Sam? No? You're doing TCMP, right? Okay. You too? Okay. Anybody else? Okay. So, you know, again, with herbs, if we look at blood deficiency, you know that there's, you know, a lot of formulas that tonify blood. right? There's a lot of different formulas. So which formula is best for this patient usually should be able to be chosen based on the way that you write your diagnosis. We'll go through this in a minute, but this is kind of my way of breaking down the case, the way that I think about it, which is a hierarchical way of looking at pattern differentiation. Okay, we'll spend a little bit of time in this in a second. And then, of course, the differential diagnosis. Sometimes you're given ambiguous information. And your job is to choose the best, right? You know, if it was a multiple choice, they would give you 2 answers that are probably not right, and then 2 answers that you really have to think about, and they both might be right under certain situations. Always objectively look at the information you're given and choose the best. Understand the difference between the other possibility, right? I'll use examples to talk about that. Okay, when you're writing your treatment principle, in almost every situation, it should match your diagnosis. Treatment principle, you know, will, again, just in terms of wording, if you have a heart blood deficiency, your treatment principle might be to tonify heart blood, right? Nourish the blood of the heart. The exact wording is a little bit malleable. Okay, tonify heart blood, nourish blood of heart would both be correct. If you have any sign and symptom related to spleen weakness, it becomes tonify spleen to produce blood and nourish heart blood. Okay, something like that. Some considerations, other considerations. Is everybody familiar with the actual treatment principles in TCM, the 8 treatment principles? Make sure you're using these terms, and then, you know, we expand these. Are you releasing? The first one here is release exterior heat, release exterior cold. Take each one of these and break it down. You know, these are just a list of the 8 here. All right. Are you addressing the chief complaint in your treatment principles? So often when scan down here, often when you are, for example, pain is the chief complaint, we may actually relieve pain, right? Or in the example that I gave earlier of a kidney and liver yin deficiency with liver yang rising causing headache, right? It's important that you don't just tonify the kidney, but you quote, anchor the yang rising, because that is what's causing the chief complaint. That becomes part of your treatment plan. It becomes part of the way that you're choosing points, all right? Sometimes it may be even more direct, you know, and stop bleeding, okay? We have, you know, abnormal menstrual bleeding, right? And the cause or the diagnosis is a spleen not holding blood or kidney weakness or whatever it is. And yes, you're going to strengthen the spleen, but as part of your treatment principle, you want to stop bleeding. I mean, you want to astringe. In acupuncture, there's different treatments that will focus on that specific aspect of it, which really is the branch. This is the branch. The pattern is the root. Okay. And again, if I go back to the idea of using that concept with the idea of, if you write a diagnosis, I should be able to choose points in treatment, right? If you're including that as part of the treatment plan, again, it's that same idea. Okay. Treatment plan. I don't want to spend too much time on this. Of course, acupuncture is a major, main method of treatment. But when you're thinking of acupuncture, you may want to consider moxibustion or other aspects of manual therapy. I mean, they're all really grouped into this one. An acupuncturist is expected to understand these other treatment methods, not just putting needles in, right? Cupping, gua sha, moxa, bleeding, okay? In the actual cases, you will have to explain why you're doing each point. So, normally you're only doing 4 points, or I'd say 4 to 6 here to leave you a little bit of space, but usually think only 4 points, right? And within those 4 points, you want to do everything that I've said so far, right? If you're just doing the acupuncture section, that's all you have. So are you addressing the root and the primary pattern? Are you addressing their chief complaint, right? And then, the benefit or the power to using less points is it makes you more critical. So it's better for learning. It's also, sometimes better for treating. I mean, we may choose a lot more points in clinic than 4. We may use more than 4, but, sometimes we just use that many. But being critical about the point selection, I mean, that's where it comes into play. If somebody has, again, you use the example of headache caused by kidney and liver yin deficiency with liver yang rising. So, what are the important points here? If you can only choose 4, we can write them up here. We can debate between each other why, if you have to all come to a consensus on what are the best 4 points, that means that whatever 4 points you choose, you have to really justify why that's better than the point she chose or he chose, right? To do the same function, to nourish the yin, because there's a lot of points that nourish yin. So why is this one better than that one in this specific case? Okay. The frequency, the course of treatment. We were just talking about this with chiropractors. Often acupuncturists and TCM practitioners aren't always the best at it. There's a lot of general rules, but this is something that, we don't really have prescribed in our textbooks. Some of the more modern TCM textbooks from China do have this. They actually prescribe treatment should be X amount of times per week or every other day or blah, blah, blah for this long. One course of treatment is this, right? In general, for the acute conditions, we do more frequently. We don't have to do it as long. For chronic conditions, we do less frequently, but for a longer time period. But you should be able to do that with your patients. They come in, how long is it going to, can you treat my headache today, right? That's what they want to know. Can you cure this is what they ask. Well, okay, this is your treatment plan. This is what I want you to follow. And based on X research, we should be able to create some shift. Tinnitus was something we were talking about, right? Last week we were talking about tinnitus. Well, how long? Okay. For herbs, those of you doing herbs, focus on the formulas that they list. So they give us a list of formulas. I know that, different, even myself, I learned some different formulas than this list based on, the textbooks we were using or whatever, but they do give us a list of formulas to make it a little bit more concise, right? And so focus on using those formulas and their usage and which, in each category, which formula is more useful for what manifestation of that pattern, right? Of blood deficiency, for example. You can modify it if necessary, and then don't, again, when you're writing your treatment plan, don't forget to write out the usage, right? So this formula, this many times per day for this long, and then reassess, right? Something like that. Lifestyle, if necessary, diet, work stuff, work considerations. Referrals, I should have put that down here, super important. When do you think that patient needs to see another healthcare practitioner. If they have signs, you know, again, the example of chest pain, you know, pretty much every time I have that patient and they have chest pain and it is of any concern, you know, when's the last time you talked to your family physician about this? Have you had your heart checked recently? You know, anybody over, you know, 40 or 50 is at risk of, well, the demographic that's most at risk for a heart condition. And that's not within my, you know, I want them to have that information. It's beneficial to me if they have that information, if they go to their doctor, they say, well, everything's good, stress test is good, you know, we have no diagnosis, all right, great. Well, then it's all on us. Sometimes the information they get might be useful. Oh, they have high cholesterol with clogged artery. Well, you know, that to me is clinically useful in TCM practice. So know when to refer. Injuries, you know, is it a tear? You know, based on the signs and symptoms, do they need to, do they have a ruptured disc or whatever, you know? Any questions on this? That's the end of this little brief intro here. Any questions? Is that helpful for you guys? Does that help a little bit with? Okay. The next, let's see, how do I get rid of that? Is that big enough to read? It's not really, is it? Aha. Okay, the next, I don't want to spend much time on this. I really need to keep an eye on the time. It's already 10. And I want to spend most of the time with actually doing the cases, so we can apply all this to the cases. But those of you that are less familiar with it, the pattern differentiation. So 8 principles is the most important. You have a handout that's, we don't really have to go through, but it is a chart that, you know, we use in foundations to teach 8 principles differentiation. Pattern differentiation is the process of deciding, analyzing the signs and symptoms to quote unquote differentiate which pathogen is present, which vital substance is weak, what organ is affected. All of this TCM diagnostic information, signs and symptoms is, you know, utilized in differential diagnosis. 8 principles is where we start. Exterior disease versus interior. Exterior disease is always these colds and flus, exterior pathogens, or, you know, in certain situations like bee syndrome, it may be wind, cold, damp, you know, bee syndrome. It is an exterior pathogen, but it's in the joints is where it's located. Now, traditionally, when we talk about this, we really, what we mean is it is it in the meridians or is it in the organs? I mean, an interior disorder in general is affecting the organs, right? The Zong Fu, where an exterior pattern or pathogen is really affecting the meridians or the channels. So, you know, yes, that could be Taiyang syndrome, that could be an exterior pathogen, but okay. We also need to differentiate the heat, whether this is more heat type or cold type, whether this is an excess type or a deficient type, all right? Vitals, yin and yang also, right? But that's so broad, it's like not useful, not clinically useful in diagnosis, and many times, all right? I'll look at how all of these piece together in just a second, so let me just scan through these. So vital substances, we can look at the specific signs and symptoms. That would be, for example, when we look at, okay, well, we have poor digestion, loose stools, you know, a pale tongue with a white coating, you know, teeth marks, blah, blah, blah. These are all signs of spleen deficiency, right? Everybody knows that. Well, my first question is, well, what's deficient? You say spleen deficiency. Spleen deficiency in what? Is it? What if the pulse is tight and slow, right? So, a lot of times you guys have spent so much time on these basic patterns. Oh, I know it's a spleen weakness, teeth marks, of course. That's not going to help you answer the questions most of the time, because there's usually more than, that's not enough. When we look at the vital substances, that section of differentiation really focuses on, well, okay, so if somebody has palpitations, difficulty sleeping, a thin pulse, right? What are you thinking? Heart blood deficiency, right? Okay. I didn't say the color of the tongue yet, right? I didn't say whether the tongue was peeled yet. So what if it could have been what I just said, that little group of signs and symptoms, if combined with something else, well, what's the difference between heart yin deficiency and heart blood deficiency? If you look those patterns up in Macchioccia, you see at least half or more of the signs and symptoms are the same, right? And so differentiation focuses on what differentiates these two patterns that are very similar. What differentiates liver fire from liver yang rising, right? How, they both share a lot of signs and symptoms. In both cases, we'll have a wiry pulse. We may have headache. We may have thirst, red tongue, all right? So what differentiates these two patterns that are very similar and share a lot of the signs and symptoms and may both be common causes of a similar illness? Headache in that example. Clear? Okay. And then, generally you should understand 5 elements and interactions. I won't spend too much time on that. It is often incorporated into Zhang-Fu syndrome. So Zhang-Fu, the Zhang-Fu patterns are the largest, usually in Macchioccia and other textbooks. So this is really what we focus on with pattern differentiation. And Zhang-Fu, if you actually read the patterns, they are a combination of 8 principles, vital substances, and organs, right? So for example, heart, blood, deficiency. Well, 8 principles, it's a deficient condition, and we'll have all of what you see here as deficiency signs and symptoms may be present. Blood deficiency in general, so for example, dryness or dizziness or, all these, blood deficient signs and symptoms that they may have, pale complexion, pale tongue, and then specific signs and symptoms that indicate an organ is being affected. All right. Any questions on that so far? Like, these are the way that we structure it. And so in my mind, when I'm looking at a case, I'm not always, what I find when teaching and when I find with a lot of students, they're jumping right to the Zhang-Fu pattern, and that's where you're prone to make mistakes, okay? You're prone to say, oh, this is spleen qi deficiency, rather than question whether it's spleen yang deficiency or qi deficiency. Make sense? So, that's why I'm bringing this up here. So it helps us, I know this is a little bit small, but it helps us go through this process. This is not complete. There's other ways of looking at this, but this is a general progression when I'm looking at a case. I first look at that chief complaint. In clinical practice, this is looking at clinical practice rather than a written case study per se, but we're using the 4 methods to gather that information, of course, right? Subjective and objective information in TCM comes from using the 4 methods of diagnosis, all right? I'm thinking of 2 different things. Like I said in the beginning today, I'm looking at what is the cause of the disease or of the disharmony. I'm looking for what is causing it. In TCM, there's 3 groups. There's either the 6 pathogens. These are the only things that cause disease in TCM. Everything, and it may or may not be important in your treatment itself. So they may or may not give you a cause, right? Like, you don't know why the kidney Qi deficiency is there, but they may very well give you a cause. All right, started with an outburst of anger, for example, or upon injury, whatever. All right, so the 6 evils are the 6 external pathogens. The emotional factors are internal patterns, and then the 5 miscellaneous include, diet. Okay, I had X symptoms after eating this, right? They include trauma. They include, work-related strain or, other lifestyle-related onsets. We see these all the time in clinic, right? Oh, neck tension from working at a desk all day. Oh, hips hurt from driving, whatever it is, right? Make sense? So initially I'm looking for that, and then I'm grouping, I'm going to the pattern differentiation. I'm looking at a principles first, right? In most of the time, immediately figuring out whether it's an interior or exterior. I mean, that's often the first thing we look at. Is there an exterior pathogen present or not, right? If there's an exterior pathogen present, I then immediately start thinking back to the 6 evils as causes, because those are the exterior causes. And then I'm looking at the nature of that pathogen. Is it a yang type or yin type? If it's a yin type pathogen, meaning cold or cold damp, right, then I'm thinking Shanghunlun 6 stages, all right, 6 cold type, yeah, Shanghunlun 6 stages, sorry, and go down here, right? If it is a yang type or heat type, then we generally go to the Wenbing, and we think either the 4 levels, which is not written there. Really, Wenbing includes the Sanjiao, so this should say 4 levels rather than Wenbing, or Sanjiao for damp heat, summer heat, right? These are the exterior pathogens. Pretty much are all contained within these 3 models of pattern differentiation. Now, in your TCM textbooks, you will now see signs and symptoms specifically related to all of these 3 pattern differentiations. 6 stages has specific signs and symptoms associated with each stage that you are expected to know. Clear? Clear. Good. Okay. Now I'm going to make this a little bit complicated just because I want to be clear, all right? And really this mind map needs to be much bigger. That in these 3 pattern groupings, an exterior pattern is only the first one, really, right? So, the treatment principle of releasing exterior is only the first of the 6 stages, or the Wei level, the first level of the 4 levels, or the upper jiao and the san jiao, right? So, actually, these then will circulate back to internal as soon as it goes through that first level, right? The disease now, even if it's an exterior in nature, or sorry, if it's an exterior in origin, right, in terms of cause, it really shouldn't be identified as being exterior if it's now gone inside or deeper into the body. Okay, less teaching, more summarizing. When it's not an external disease, I immediately go to internal. Internal could be one of the 6 pathogens, right? Is there heat present in the body, right? Is there signs and symptoms of heat in an organ? So when it's internal, usually my mind goes simultaneously between excess and deficiency. So let's say that's the way I think. I know that's not written here, is it? No. So internal, I think first excess deficiency. If it is excess, I think 6 pathogens again. If plus phlegm, right? So six pathogens plus phlegm, right? One of, if there's too much of something, those are the only things that I am trying to eliminate from the body is a pathogenic presence. If it's deficiency, I think what's deficient? Is it qi, blood, yin, yang? Before I think of organ, I'm usually looking at that. If it's a deficiency, once I figure out what's deficient, I want to think Zongfu pattern, right? Where is it deficient? Okay. If it is excess, I also then go back to Zongfu pattern. Where is the excess? Is it damp heat in the middle jiao, spleen and stomach, or the lower jiao, large intestines, right? For example, is it phlegm, damp, misting the heart, or is it phlegm, damp, blanket, right? Phlegm, damp, with spleen deficiency, for example. Okay? Any questions? I told you I was going to cover 60 hours in like 1 hour, right? Okay. Yeah. This one you have this one. What I said? Okay, write down fast, because I won't remember it. I'll have to think of it again. Yeah. Just all you have to do, the only thing that I said was that internal, I go first to excess or deficiency generally. So 6 evils is excess, right? Excess would go to 6 evils and deficiency to vital substances. Now, I have to, again, put a disclaimer there, is that qi stagnation and blood stagnation are vital substance patterns that are excess in nature. Okay, so it's not always so simple. You want it to be so simple, but it's just not. All right, any questions on that? Bam. Okay, and then I'm gonna, because we just have to keep moving, basically. Yes, of course.
When you're saying qi and blood stagnation is an excess, so would blood deficiency never result in stagnation?
Oh, of course it could. This is not black and white. That is a good example of what I mean by a primary and secondary pattern. So you should understand that when the blood is so your question. This gets back to that first outline that I gave you. When you see signs and symptoms of blood deficiency and blood stagnation, your question is, what is your treatment priority? Sometimes, if you move blood without nourishing, is bad, right? And most of the time it is. Sometimes, if it's only very, very minor signs and symptoms of stagnation and primary signs and symptoms of deficiency, simply by nourishing the blood, the stagnation will be eliminated. You know what I mean? I mean, most of the formulas and a lot of the points, even spleen 6 is, Ge Shu, is UB17, are used for both deficiency and stagnation. So, Su Wu Tang, right? Su Wu Tang is the main blood tonic, which, right, it moves blood too. So, most of the blood deficiency treatments will include little bits of moving as well. All right, so just a very kind of brief run through of the 8 principles to give you an idea of what we mean by differentiation. So you're going to be given some random set of signs and symptoms, and you have to, based on what you're given, decide whether this pattern is exterior or interior based on these signs and symptoms. So, more specifically here, exterior patterns in general, the pulse we would expect to be superficial, right? But very specifically, this group right, I don't know why this mouse like flashes. Is that driving anybody else crazy? Okay, no, okay. So more specifically, this group of the three signs and symptoms here, right? chills, fever, headache, body aches are actually the most important for differentiating exterior, right? Interior here, you can see, we see the effect going inside the body, right? We see the effect of the pathogen on the organ system in the form of constipation, urine changes, etc., etc. All right. Heat and cold differentiation. Is this wind heat? Is this wind cold? Right? Okay, if we see, oh, patient has cold and flu with a floating pulse and headache, well, that could be present in both. It's not specific enough. So I'm searching for specific signs and symptoms between these two to decide whether that's heat or cold. Excess deficiency, all right? Generalized deficient signs and symptoms.
Are we able to get this in the electronic form?
I could ask her if she can email you this. Yeah. Why do you want electronic? You have printed.
Because I like to keep things in my computer, so I don't use them, and I'm writing stuff on it, so I don't think it's
Okay. At any rate, this is like this section specifically is very basic. It should be very basic right now. But in fact, I don't even really want to go through it anymore. I want to use the cases, but that's the first thing that I'll look at. When you may, again, I'll use the example of, if we're talking about developing a treatment plan and developing treatment priority, we have to take these questions into consideration. All right. So let's take a short break. It's already 10:30. I thought that was going to be like shorter, like 30 minutes, but it wasn't. So let's take a short break, and then when we come back, I'm going to give you a case, right? And we're going to go through it. We're going to do it.
So how long is the exam that we are going to take? How long will it be?
Today or there? So you have 3 hours for 3 cases. Yeah. Oh yeah, I'm giving you exams.
Those are the cases.
I'm giving you the cases, yeah. But you're going to have much less time to do them.
That's what I was asking.
Yeah. So I'm not giving you an hour. Oh God, no. I have to experiment. We'll see, but I'm planning on 20 minutes.
So
You're going to do them
and then work through
them as a group. Yeah.
It's not a real exam, it's a practice exam. It's an exercise, right?
We're going to do
marked literally, but we'll be marked.
Yeah, I'll just have to check with them. I mean, I don't think so. I don't think you're getting marked for this, but yeah, I mean, I don't have time to mark them. That would take too long. Well, I guess I could. I guess I could mark them while you're doing the next one. But.
This is any standard how you have to answer. Like I have 3 workshops. Every workshop different. Like 1 case study, 3 workshops, 3 different answers. Like is this any standard you can go through how to answer?
So the wording itself is not, it doesn't have to be exact, right? So I use the example, what did I say before? Something about nourishing blood versus tonifying blood, like tonify heart blood versus nourish blood of heart. They're 2 different ways of wording the same treatment principle, all right? So,
who knows where is this standard?
It's not an opinion though. So that's what I'm trying to teach you is that, so, all right, in the literature for the case studies, they do say that there is some gray area. There's some, I shouldn't say that there's a gray area. They say specifically that the wording does not have to be exact, all right? But it doesn't mean that your diagnosis is not the same. Heart blood deficient, or Let me think of an example for a diagnosis. Or I use the example of kidney and liver yin deficiency with liver yang rising. So if I say that as opposed to liver yang rising due to a kidney and liver deficiency, for example, right? Is that they're two different wordings that mean the same correct diagnosis. However, if you say liver fire, that's not the same pattern. That is incorrect. It's not I mean, there are many books, but the major books on diagnosis in English that are listed on the list is Maciocha's book on diet, which is like this thick. Yeah. So look at those patterns. I would focus on those patterns. They have professionals like me marking. Right? Yeah. What I would like to do is have you trade with somebody else. Trade your paper. You didn't know that. Okay. Yeah. So the reason I want you to do this is because now you will get a feel for what the evaluators are dealing with. So when I give you the correct answer, you'll have to evaluate yourself whether that other student wrote it correctly. Kind of addressing that, yeah, right? Okay. And before we go through it very quickly, this is what is on the website about the marking for the written clinical cases for the CARB Pan-Canadian exam. So it doesn't have a specific number of points per, illness or TCM differentiation or treatment plan, but it does say that there are essentially, several marks. And then this is specifically important. It may be specifically important here. Remember, part of what they're looking for is your ability to understand and explain what you're doing. You have to have the knowledge behind it. So in your wording and explanations, you can put other ways of wording things in brackets or parentheses if you think that it might be helpful for somebody else to understand what it is that you're trying to convey. All right. Any questions? Clear? Clear? And then just to be very clear on the policy with written information, right? Bilingual dictionaries, printed versions can be brought in, and other printed references. All right. So specifically if that's if you think that would be helpful. Okay. Any questions? Awesome. Good. So let's look at this case. Oh, that's not very bright, is it? Does that help? Wow, it's really dark. Is that that's the picture I took, I guess. Okay. Will that brighten? That just zooms it. It doesn't brighten it. Okay. So this is not really the correct answer right now. I'm gonna do this first one with you. I may do another one with you, probably not in the same way, but this is what I go through in my mind as I'm reading it. Okay, 42-year-old male worker, chief complaint, coughing that's intensified for 3 days. So immediately in my mind, I know there's lung involvement if there's coughing. I'm already into my later parts of diagnosis. 3 days indicates to me that it is likely exterior. Sorry?
Unacute.
That means acute. Yeah, I mean 3 days is acute. So, but the question is, what does it mean? Right? It's not the question, not what is it, right? What information do I get from it? All right. If it's intensified for 3 days, you know, when we contrast that with that it started a month ago, I put a question mark here. In my mind, I think, oh, well,
Was it chronic but aggravated recently?
right. Okay. So that's what I'm looking at. All right. Now, with the acute pattern, immediately I'm thinking exterior pathogens. Now I have other signs and symptoms that confirm it. So in that chart, internal or external? In external, chills, fever, aversion to cold, aversion to wind, headache, body aches, floating pulse. Major things that indicate its exterior in nature. So I have my first one, which is aversion to cold, is an indicator that it is possible exterior. There are other things that can cause aversion to cold. It's not confirming yet. Okay? All right. Additional symptoms. Fever and shivering. Well, that to me, exterior. No, not heat. Not heat. I mean, fever, remember, fever, chills and fever are present whether it's heat or cold. Why? Because cold obstructs, so chills are because the damage to the Wei Qi. So even in wind heat, we have chills. Your pores are open, your Wei Qi doesn't protect itself. Fever is a reaction of your Zheng Qi, essentially your immune system, your response to a pathogen, whether it's cold or heat. So chills and fever, especially simultaneous chills and fever, may be present with exterior cold or exterior heat. Okay? Any questions? We can make no distinction yet. All right? We're getting there, don't worry. But the point is to identify the problem. Identify what the problem is with the diagnosis. What was hard about it, right? It was hard. Why? Okay. A little sweating, so the stuffy nose and sore throat. So the sweating, again, could be cold or heat. It's not differential, but when I combine that with sore throat, in my mind, I'm thinking heat, based on what I've seen so far, all right? Aversion to cold, you know, it may lean a little bit towards the cold side, but when I see sore throat, I'm thinking in my mind, oh, it's likely heat. There's some heat present, right? Chest pain, what does that mean here? Chest pain while coughing, that's interesting. What? Because of the coughing. But my question, how does that help you in TCM? Well, normally pain definitely indicates stagnation of some sort. I didn't write anything here because I don't know what it means at this point. So it could be, there's two major possibilities. Because it's aggravated while coughing, it may just be that the abrasion, that it's a, what we would describe as like a hard or yang cough, a hacking cough, something that's like kind of abrasive and harsh. So it's not entirely clear to me, but it will clear up in a second here, all right? Now, up to this point, we have very little information. Stuffy nose, well, that indicates a little bit of phlegm, but nothing else so far has indicated phlegm as a major pattern because stuffy nose is often present. But this next line here, phlegm that is white and sticky containing bubbles, indicates what? What kind of phlegm? No. Phlegm damp. Phlegm damp or cold type, right? There's not heat here. If it's yellow and sticky and difficult to cough up is the main indicator for heat type. And then I read the next line, which says sometimes mixed with yellow and thick lumps. Oh, well, that is heat type. All right? So immediately here, what are the questions, before I even go further, what are the questions going through your mind right now, right? Well, is this phlegm heat Is this a heat type pattern or is it a cold type pattern? Because as I said, I read sweating with sore throat and fever. You know, these are all indicators of wind heat. But then I go down, I see white and sticky phlegm with bubbles. With, you know, that's a phlegm damp, a cold type pattern, right? Aversion to cold is a cold type pattern. Is this more, you know, I'm pretty much confirmed at this point that there is an exterior pathogen involvement, right? There is an exterior pathogen involvement. But there's something that's, you know, preventing them from going through the normal progression of getting rid of a pathogen in however many days or a week, you know, 5 days or something tops to, you know, normally get through something like this because it's been going on for a month, right? The coughing at least has been chronic for a month, right? It's just aggravated recently. And so when we look at, remember when I said, well, we can think two major things. Well, one, I'm looking at what are the signs and symptoms of the current state of his disharmony, but I'm also thinking in my mind about the onset or cause of his major symptom. Okay, so is it from exterior pathogen or is it from phlegm? Which is generally not, you know, we wouldn't get, generally we won't accumulate so much phlegm in 3-day time. Well, that I don't know. I'm just making presumptions in my mind. That doesn't mean it's chronic.
It's chronic and infected.
Doesn't mean that.
Because sometimes, so it's not. Because for the first few days, it's usually the white.
But you're making presumptions. I mean, all we know when we see yellow, thick phlegm, right? Yellow and thick lumps. All I know from a TCM perspective, I can't say it's chronic. I can't say it's an infection. Like, people have yellow phlegm without it being an infection sometimes. Yeah, for sure. What does that mean in TCM? Because infection is not what you write on your case study. If you write that, it doesn't go anywhere with you, right? What does it mean in TCM? It means that it's heat type. Okay? So moving on, thirsty but not willing to drink. What does that indicate to you? Incorrect. Doesn't indicate dampness. Thirsty.
Right. Heat. The heat, right. And also.
A little heat, right? I mean, thirsty, you know, straight up dampness would be no thirst, but thirst without, you know, in most of the Maciocha's wording, we see thirst without desire to drink. That is common in what two major patterns? Damp heat, and what's the other major pattern that's sign and symptom is, it's similar to damp heat, would be phlegm heat, okay? Bowel movement once on the other days. I actually don't know what that means.
Because of the dryness of the
No.
And the fever.
Only one time every other day.
That's what I assume, but in terms of English language, that's not very clear. Once on the other days, I think it means once every other day, which means once every 2 days, which means, you know, could indicate a little bit of heat. No improvement taking oral pills or after injection of penicillin. Okay, so talking about, is this an infection? Well, we don't know. All right, so you see right here, I'm not going to scroll over, but you see right here I have the questions, the first questions that I have in my mind right now. Or actually, let's just finish because we're almost done going through it. Actually, no. Before we do this quote-unquote objective signs and symptoms of the tongue and pulse, based on what we know, I want for you to answer, is this internal or external, right?
Is it external? Is it still external turning to internal? Turning to internal.
Yeah.
Okay.
No, I'm beginning with the internal. External. Start with external.
Okay.
But right now it is internal.
Okay, what is your treatment principle? Is your treatment principle to release exterior? then the diagnosis is external. If you're going to release the exterior, the pattern, the diagnosis is external. Or a combination. I mean, but if you are, this is thinking in reverse. Sometimes it's harder to write down the diagnosis than it is to know what your treatment principle is. This patient has, it says past tense. It says had fever and shivering. Okay.
Because it's injecting penicillin, it is indicating that patient has infection and also has been treated. That's why it doesn't have a fever anymore.
Where do you think what do you think you're doing? What do you think this is? No, we can't make that assumption. We simply can't make that as an assumption. We can't. Right? We have no, don't make assumptions, especially from other medical paradigms. Yeah. So, all right, anyways, the other question that I have here is it cold or heat? What do you think?
External, and it's a heat because of the constriction.
Okay, so this is external heat. That means your treatment principle is to use cool, acrid herbs that release the exterior. Is that correct? That means that your treatment principle is release wind heat from the exterior. Is that correct?
External
I think it started as with cold.
Why?
Because it started with the cold 1 month ago. It says because it's turned into the other. That's what I was saying.
Okay. So let's go down to the tongue and the pulse. Let's focus on this now. All right. We have a relatively mild fever. All right. The tongue is pale with a thin white coat, which would indicate to me, no, not in this case. Of course, a pale tongue could indicate blood deficiency or Qi deficiency, but in this case, I have no other signs and symptoms of blood or Qi deficiency. What does the pale tongue indicate? That it's cold type, not heat. If there's a lot of heat present, what do you look up when you see phlegm heat? What do you look up with wind heat? We see red tongue, right? So, and yellow coating. In this case, the fact that the tongue is pale with a white coating indicates to me, when I'm thinking about this question here, that plays a great significance, right? It plays an important significance to me. Furthermore, we go down to the pulse. The pulse is floating. Because the pulse is still floating, when we're questioning, so what are the major two patterns? We see an exterior pattern. What's the secondary? Phlegm. Where? In the lungs, right? Now, phlegm in the lungs is not an exterior pattern. The herbs that I use to treat this do not release exterior. Urchin Tong does not release exterior. Stomach 40, Feng Long, does not release exterior, right? The treatment principle is different. Exterior and interior patterns. So my question is, it's not that we can't do both. It's understanding the importance of the two patterns and how they relate to each other that we're focused on, so that you don't get confused. So when I look at, when I'm justifying the points that I use or the herbs that I use that do release the exterior, the way that I'm justifying it is based on this information. All right? And the slippery pulse, of course, indicates phlegm. All right. Now you have everything broken down. You have all the information they're going to give you. You would love to have more information, right? What information do you want? You'd love to have more information, but you don't have it. And now you have to write your diagnosis and treatment plan. Okay? So, based on that, Well, what's the illness? That's easy.
Coughing.
Coughing is correct. All right.
You need to be more specific, like if you like justified as a virus, not bacterial, because we are no Western.
How can you do that?
Well, because
How can you do that?
didn't work, so.
It doesn't justify it. That's not a Western medical diagnosis. You would get in trouble for doing that. That is professional malpractice. You guys are not allowed to do that. Just because a virus or bacteria is not improved with the medication, it does not mean that it's not a virus or bacteria. I mean, I know that, and I'm not a biomedical doctor. You guys should know that. It's not that keep it simple. I'm like, these two questions concern me, right? They concern me that you're still thinking like that. It means you're not thinking like a TCM practitioner. All right? Chronic and acute cold. So what is the problem with that to me? Does anybody else see a problem with that? What?
Cold normally is not chronic.
Okay. So the first problem that I see is you haven't addressed the phlegm. No, you didn't say phlegm in your diagnosis. You also didn't say phlegm damp in your diagnosis. You also didn't say phlegm damp in the lung in the diagnosis. All right, see what I mean? That's what I want. I want that specific. If you just say chronic and acute cold, that's confusing to me. Okay?
So I put as a...
Hang on. I'm going to get into a little bit of trouble because I can't reach the board with this. Can I? I can?
Yeah.
Yes.
All right, just...
It says little knot in there. Maybe you unknot it.
Okay, tell me your diagnosis. The one that's on your paper. Okay, illness is coughing. Sorry, for illness, that's correct. Coughing is all you need. There's nothing else you need to write for the illness specifically.
If I had a cold, would it be okay? Say the nasal discharge.
Yeah. Cold and flu is not as good as coughing in this case. And furthermore, it's not only due to the exterior pattern. Because we have the presence of phlegm, it complicates it a little bit more. Right? And again, the specifics of, for example, herbs that release the exterior and treat, quote unquote, the broad scope of cold and flu versus specific herbs that stop coughing but may not release the exterior. Points that stop coughing that are not exterior releasing. Okay, in this situation. So coughing is the correct answer. All right, pattern. What is your pattern differentiation here? Sure, go ahead. You are so enthusiastic. Let's go. All right.
I picked the one that I thought. Invasion of lung by wind cold.
Sorry. Pattern. What? Sorry. No. TCM pattern differentiation. TCM pattern. Right? What is the TCM pattern? Anybody else? Nobody else wrote one down? Go ahead.
I think that I should have wrote a little bit more, but I put external cold syndrome. But what I wanted to do now, after we had the conversation, add with internal like phlegm heat rising or something, something along those lines, so that we know that it's a mixed pattern that's showing up, right? I could be wrong.
Okay.
I said inversion of external neuro, and I mentioned dampness and heat.
sorry, invasion of external evil
plus
damp heat. Okay?
I said externally contracted wind cold leading to wind cold attacking the lung and from that.
Whoa, sorry, slow down. I'm trying to rate here. Externally
contracted wind cold leading to wind cold attacking the lung and phlegm damp.
Okay. Anybody else want to go?
Activation of the flame heat in the lung and yang deficiency.
And what?
Yang deficiency.
Yang. All right, I'm only doing this on this case because we won't have time to do this on the other cases. I'm going to destroy you guys. Okay. But this is how I think as a TCM professional. You write invasion of lung by wind cold. I ask you, why is the pulse slippery? Slippery is not a pulse of wind cold. No.
Well, I said that because it's torn into the ugly.
Okay. Okay. So then your treatment principle is to release wind cold from the exterior. You're not treating phlegm, is my point.
I'm starting to treat the lung because it's actually being affected.
Doesn't matter to me, because you're not treating a major part of the pattern, which is phlegm. Right? So in your diagnosis, yes, you need to explain that side of it in the diagnosis, because to me, invasion of lung by wind cold. To me, this is moshing shigantam, right? Am I right? Right? There's a kind of like a wind, wind invading the lung, wind cold, right? And then from the Shanghai lung entering the lung, or Ma Huang Tang, one of these two formulas that we would use for this pattern, correct? Oh, sorry. Okay. Regardless, this pattern does not have phlegm damp accumulation.
So is it right that initially it is caused by invasion?
Don't worry about why it's right yet. I'll read you the answer.
Okay.
I'll read you the answer after.
You now have to concentrate on present conditions, right?
That's right.
So that is the wind damp and the phlegm damp accumulation in the lung. That's probably the answer.
More precise.
Because we all know that it's from the wind, but it happened.
Or is it wind heat? We said sore throat.
Right?
But which one?
Yeah, okay.
But which one?
Before, right? But right now you have to concentrate on what you have. Right?
Okay, that's part of it. All right. I'm only going to point out the major things, and this is for you, but also for everybody else. It's a learning experience, right? Okay. External cold syndrome. That's pretty poorly worded because I don't know. I'm assuming this is just a weird term to use, syndrome. I'm assuming you mean external wind cold or external cold pathogen. External cold syndrome. It confuses whether you mean cold and flu cold or TCM, six evils cold. But even so, I'm assuming you meant wind cold, right? Exterior cold pathogen. Phlegm heat rising. Sorry, whose was this again? Okay. So phlegm heat rising. My question to you would be, why is the phlegm white and sticky containing bubbles? If it's phlegm heat. Why is the tongue pale? Why is the coating of the tongue white? If it's phlegm heat. Why is the pulse not rapid? Why is... Okay, so I mean, So I'm asking you, remember I said you should be able to explain all of the signs and symptoms through your diagnosis, ideally, right? How do you explain that in your own mind when you write this? All right, and I'm not quite sure the rising here in terms of terminology, I usually don't see, I've never, in my years of being in TCM, I've never seen phlegm heat rising be used to describe a cough. You know, so the major description would be like either just phlegm heat or, you know, phlegm heat misting the heart, you know, or phlegm or something. You may, by rising, you may mean rebellious lung qi, which is the cough itself, which we can always say here if we want. You know, lung qi rebellion is the cough. So that's the main, you know, I don't have too big of a problem with that right here. Okay, invasion of external evil. My first question is evil what? Which evil? Cold? Cold? So right cold, right? Because that doesn't tell me enough. It's not specific enough if you just say externally evil. And damp heat, all right? Are there signs and symptoms of damp heat here? What? Say that again? A what?
The number 3 under the symptoms. Those are signs for you. And again, heat because of the
Sorry. Say where is the sign and symptom of damp heat?
The third one.
The third one.
Yeah.
Which one is that?
White.
That's not phlegm heat. Or sorry, that's not damp heat. That's not damp heat. That's phlegm. And that's phlegm damp. I already showed you on the diagram, right? So we're go back up here. You know, white and sticky would be phlegm damp, right? Phlegm that is white and sticky. It's not the same as damp heat. It's not the same as damp accumulation either. Phlegm and dampness are two different, even though they share a lot of similar natures. You know, phlegm is specifically different treatment, different diagnosis. Okay, the only sign and symptom that is in line with what you said is that the next one, which is thirst but not willing to drink, that could indicate damp heat. But there's many problems with saying damp heat as a diagnosis here. There's nothing else because that also, it does match some heat and phlegm in this case. It's definitely not damp heat. Okay, the next one was externally contracted when cold, and then I forget how you worded it. I just put an arrow to it. Basically, you said externally contracted when cold attacking the lung and phlegm damp something, right? Phlegm damp where?
In the lung.
In the lung. That's better, right? So what do you guys think about this? So my question, if I read this, is how do you explain the heat signs? Because there's sore throat, there's thirst, there is some yellow, right?
Yeah.
And the bowel movement is every other day. So my only question here would be, how do you explain the heat signs and symptoms? And if you can explain them in your description, this one's pretty good.
I was gonna put like a.
That's not why there's heat signs.
I couldn't figure out how to.
Are there any signs of yin deficiency? No. No signs of yin deficiency in this case. Latent heat? Almost. It's not the same as latent heat terminology. Where is it? Yeah, where's the heat? So I'll go back to this one in a second. Accumulation of phlegm heat in the lung. So again, I'm going to go into it. Phlegm heat in the lung is a specific pattern. The signs and symptoms are sticky yellow phlegm that is difficult to expectorate, difficult to cough up, a red tongue with a yellow coating, a slippery and rapid pulse. These are the main signs and symptoms of phlegm heat. So the fact that it's written first, that it's white and sticky with bubbles, and then occasionally there's some yellow chunks, or lumps, yellow lumps in it, is not the same as what I described for phlegm heat. Because in phlegm heat, the treatment principle is usually to lubricate the lung to make it easier to cough up. Doesn't say that he's having difficulty in that way. Plus the tongue and the pulse do not match. So that's the problem here is, phlegm heat is not really the nature of what we see here. Okay, what are your signs and symptoms of yang deficiency? Why yang deficiency? Pale tongue does not indicate yang deficiency. Pale tongue could be qi deficiency, blood deficiency, whatever else I said, right? It's not that's what, you can't take one indicator alone like that. So this is the best option, or the best diagnosis here. So where is that heat? I have to know from a TCM perspective that pathogens stagnate and generate, or commonly when cold as a pathogen often transforms into heat, and stagnations transform into heat. So the fact that there's a little bit of these heat signs is not uncommon for when cold, and it's not uncommon for a longer standing, this month-long history here. So again, in terms of how do you choose and how do you write the diagnosis, you have to ask yourself your treatment focus. Are you going to focus on clearing the heat in this case or not? Most of the focus is on, is on transforming the phlegm, phlegm dam, right? And and releasing the exterior. There's still some of that exterior pathogen present, as I said, with the floating pulse and whatnot. And stop coughing. All right, so including the illness itself. Again, the fact that an aggravated cough, there are points, acupuncture points that where the function you read is to redirect rebellious lung qi. That means they're symptomatically used to stop coughing, right?
So in the one that I did, I should have put the same thing, but with phlegm and tongue.
Yeah. So I'm going to read the actual answer here. Illness is coughing, syndrome differentiation. Now remember, you have to explain this, right? So just giving you an example. You'll have a bunch of these, you'll have the answers to as well. So when cold invading the lung, obstructing the trachea is what is described. Obstructing the, you can write this down if you want, but I'm not, remember, you should be marking somebody else's paper right now. So the question is though, all right, this is an example, like I would never write obstructing the trachea. I would personally never write that. Okay? No, I wouldn't write that.
It's a Western diagnosis.
No, it's not. It's not. I mean, what he's trying, it's just not the wording I would use. I mean, what he's explaining what we mentioned about cold causing stagnation, right? The heat of sore throat obstructing the trachea, right? What he's indicating is that it's causing a stagnation. So that's not incorrect either. It's just not the terminology I would use, but I'm using this as an example of, what they're going to be going through in evaluating their answer, okay? Lung qi is unable to ventilate. So I was going through these as an example of how I would critically, there may be a little bit of space with some of these, as long as you explain very clearly why and how that phlegm, those phlegm signs and symptoms. So where your answer is possibly okay is if you explain in the explanation that it is causing obstruction of lung and phlegm accumulation. And in your treatment principle, you are addressing that, not just when cold. Okay? Lung, she is unable to ventilate, leading to coughing, stuffy nose, and runny nose. So he's explaining all the signs and symptoms. Causing, it also causing white and clear phlegm with nasal discharge. So he's explaining the relationship between the wind-cold obstruction and the phlegm accumulation. The diagnosis is coughing of wind-cold type. Okay. Reasons for the diagnosis: shivering and fever are the symptoms of exterior syndrome. White and sticky sputum would mean cold. It's incorrect. It's not cold damp. It really means phlegm damp, not cold damp. It can be confirmed by the evidence of runny nose with white and clear phlegm and nasal discharge. Pale tongue containing white to yellow coat, okay, that's contradictory to what we have, hang on, would be the symptoms of cold syndrome. Floating and slippery pulse would mean wind containing a little bit of damp, which may be caused by phlegm damp. So there's a little bit of terminology ambiguity here, all right? Because these are not mine. I didn't write these, right? And this is actually the first I've gone through them, okay? Don't tell the college that. You have to pick it apart. That's why we want to do it like this, okay? So I'm gonna use this as an example because this is another TCM practitioner and I'm a different TCM practitioner. So I'm analyzing his wording in the way that he's describing and the way that he's justifying his diagnosis, okay? So the fact that he said, if I go back, where is it? So he said white and sticky sputum would mean cold damp, right? So really, to me, that means it should be cold damp type phlegm, or actually that is more specifically phlegm damp in Macioch's terminology. Because again, I separate dampness and phlegm. They're different pathogens from my perspective. But the fact that he explains,
what is the difference between the two of them?
of course I can. It's not for me. Look in Maciocha. I mean, look, I can, but I don't want to spend too much time because we're supposed to be doing like 7 of these. Okay, and it's almost noon already. So this is the only one that I'll break down like this. Phlegm is phlegm. Phlegm is a substance that's not supposed to be in the body. Dampness is normal fluid that is accumulated. Or how do we say, it's not a substance per se. So whenever we have phlegm, it is phlegm. But remember, phlegm is also the invisible phlegm, or lipomas are phlegm, or phlegm misting the heart is a psychological pattern. Phlegm can cause numbness, right? Talking about neuropathy, right? So these are common patterns related to phlegm. Dampness, in terms of treatment principle, dampness can be drained. It can be cleared through urination. Phlegm cannot. Phlegm always comes from the spleen. Dampness can come from exterior pathogens, or it can come from poor kidneys, kidney function, or it can come from poor digestion, and the spleen as well. So when I treat phlegm, I need to transform it, and I need to strengthen the spleen usually. All right. When I treat dampness, I may strengthen the spleen as well, but I also may look at the kidneys. I may have to increase urination or purge downward. Those are major things. I don't know. There's a lot more there, but yeah, that's in a nutshell. Okay. So, but my point being is that if I was evaluating this, I would not take points off because he didn't make that discrepancy in the way that he wrote it, because he explained, explained it well, and if I go to his treatment principle, all right, what is the treatment principle? Well, flip it around. Dispel wind, I would say cold. Dispel wind, resolve phlegm, ventilate the lung, and relieve coughing is the answer that he gave, okay? So the fact that he's not actually addressing dampness, and he used that as part of his explanation, I'm not going to make that, I won't really take any points off of that. Clear? Does that make sense? So let me ask you, based on what I read and what you wrote, do you see how he's really kind of, the only thing that I think he could do better in this is what I would do, and which I kind of verbally did, is I would describe the heat symptoms. I would justify, you know, this small grouping of heat symptoms, the sore throat, yellow bits in the phlegm, and I may indicate that that's likely just that cold is slightly stagnating in the heat, right? But it's not going to be part of my treatment principle, right?
If you didn't address it, it's better to just say why not.
Yeah, I would. Showing that you understand.
So is the heat because of the stagnation? Is that what you're saying?
Yeah. You know, basically in Shang Hun Lun, just in a base, this is not even with, you know, the cough pattern specifically, but exterior pathogens often as soon as they get inside the body. So it's very common for us to use the diagnosis, a little bit similar here, wind cold transforming to wind heat, or wind cold transforming to heat in the lung. When the signs and symptoms start with wind cold, and then we see sore throat, cough, you know, more fever, this kind of, okay, we're starting to get heat signs because your immune system is responding, your Gen Qi is responding. Okay? Yeah. Yeah, so, you know, it's okay. Again, like I said, if you remember, you have to explain everything. So if you explained it well enough, and, you know, again, his diagnosis was coughing of wind cold type, which is actually really the same. So his diagnosis is really narrow, small, the way that he writes it. I wouldn't write that. I would expand a little bit, talking about the phlegm. Okay, treatment. So what are the best points here? Okay. Why lung 7? Okay. Yeah. So if you're using a book, and this is one of the things I caution you about, if you're using a book, it may give you a prescription, but it doesn't tell you why they're using those points, and you can't answer this. Okay. All right.
Lung 5.
Lung 5. Okay. What else?
CV17.
Why lung 5?
For the
Right. Okay. Sorry. And what else?
CV17.
You said Ren 17, right?
No, CV17. Yeah,
Ren is CV.
Right. Yeah.
And why? I'll just go with one for now. Keep going because these are all your points. Go ahead.
Again, for the
Okay. One more point.
One more point is bladder 43. PL
43. Huh. Okay.
Yeah.
Why?
For the deficiency.
There's no deficiency though, right? I mean, we didn't diagnose her with any deficiency. So why UB43? Okay. So the only
regular bladder 13.
bladder 13. Okay. I like that a little bit better.
Yeah.
And why bladder 13?
Anticipates phlegm. If you say, you said they coughing as well.
Yeah. Okay. All right. Yeah. So, I guess the questions that I would ask, a lot of the pattern differentiations, for example, the cold and heat issues don't play very much of a role in our point selection here. They're not as much of a concern in terms of how we're choosing points. The only, up until here, the only concern that I would have is that, these are good for phlegm in the lung, all right? And then, but are you addressing the exterior? But UB13, if you're using that in there, combined with lung 7, does address the exterior. So, really, this is not a bad correct answer, even if your diagnosis was wrong, or not, not excellent. We hope that it's correct. So, usually, I'll just put a few other things out here. LI4 is commonly combined with lung 7. Now, and this is really, from my opinion, it's not a very clear cut answer of whether I would use lung 5 or not. Basically, because the history is not clearly separated, lung 5 is commonly used for phlegm accumulation in the lung, often more chronic type. But because this is he said 3 days it's been aggravated, with the assumptions that the problem is aggravated by the exterior pattern, I probably wouldn't use this. Maybe I would, maybe I wouldn't. Stomach 40.
LI4.
Stomach 40. I already said LI4 usually combined here, right, with lung 7. Would you use spleen 9 here?
Well, there's a dampness there.
Is there dampness? Did we diagnose as dampness? No. Do you see the difference here? Because spleen 9, let me just go on no, I can't, I don't want to spend too much time here.
Well,
It's all learning.
I actually took it out of one of the books because it said it has to move into first phlegm down.
Doesn't. It doesn't, really. I mean, not from a critical point selection perspective. I wouldn't think about it. Spleen 9 increases urination and drains damp. That's the main function. It's not that you can't use it. It does help transform phlegm damp accumulation through the ability to work with the spleen, because all points on the spleen meridian generally tonify spleen. But if I consider it compared to stomach 40, definitely, stomach 40 is the main point that I would think of. GB20? You could consider that. So, I'm just looking at the symptoms again here. Yeah. So because I don't see headache as a main symptom, I probably wouldn't use it. See how that correlation between the point function and symptoms may come into play? It doesn't mean you would necessarily get marked wrong, but when I'm told I can only choose 4 points, I have to be real particular about which 4 points. Well, I said 4 to 6. The guidelines I gave you is 4 to 6. Yeah. Ding Chuan. That's what you're thinking? Ding Chuan is for asthma. We could use that, but it's not specifically indicated. LI11 is not for coughing from phlegm, cold, damp type. No.
How about the REN 12?
REN 12 is for phlegm damp accumulation, but again, because the main signs and symptoms are coughing and there is still an exterior pattern, I probably won't choose it here. I like REN 17 a little better than REN 12 because it directly works with the lung. Yeah, but we don't have any specific digestive symptoms listed, so I don't, I won't immediately think of that. I know Ren 12 is commonly a major point for phlegm damp that we do often use it. Other options might be lung 1, UB 11, right? 11 and 12 are, or 12 for releasing exterior Ding Chuan. It could be used. But again, as long as you're covering these major areas.
Like which point you use exactly for the cough?
In these examples here, well, lung 7 is stopping cough. If you use lung 5 stops cough, they all stop cough. They all have functions to specifically work with coughing, which is the main complaint. No, I'm saying, UB13 also has the function to stop coughing, but yeah, definitely going to choose something on the lung meridian.
So
Any questions?
if you put the wrong point, not the wrong point, but if you put something, let's say, you put squealine and like you said, drink, damp, and phlegm, do they actually take off more? Or they just, actually remove.
I mean, you're asking these other, like, it's individual, right? I mean, like, I'm telling you from a perspective of a TCM practitioner who's, spent a decent amount of time in the field. I mean, I am not in that position. I personally may, like, if I was grading it, if you addressed everything and that was the only thing that you did that I didn't like, I wouldn't take off for it. Okay? But if you didn't address the other things, then yeah, you're gonna, I'll take off for it. I mean, if you say that point, or yeah, if you say that it, for example, stop cough or whatever, or something like that, then yeah. So yeah, that's a good question. In terms of like, do we need to clear heat? That goes back to that question on your case analysis. When you're choosing cold and heat,
What about the fever
that does not, a fever is present in when cold. Remember I said a fever is present in when cold. So the question is, do you need to clear heat? Do I need to use heat clearing points like you're saying Li11? Well, we use that all the time for exterior heat, right? Or interior heat for that matter. Yes, right. So the question is, do you treat the heat specifically? You don't need to here. If the heat is a result of the stagnation of the pathogen, when you resolve the phlegm and clear the exterior cold, it should resolve on its own, right? I mean, it should clear out. So for those of you that do herbs, the modified san ao tang plus zi shuo san is what's listed. So basically, release exterior cold and arrest coughing. Ma huang, xing ren, jing jie, zi wan, bai bu, bai qian, zi su ye, jie geng, and gan sao. Once a day for 3 days until symptoms reduce, and then reassess. For your acupuncture treatment plan, what is your treatment plan? How many times do they need to come? When do they need to come back?
Every other day.
For how many treatments?
Reassess.
How many treatments though?
I usually put they come 6 times every other day, and I reassess.
Okay, that would be acceptable to me. Again, it's not there's not a one single correct answer that you can memorize. It's, TCM is, it must be more malleable than that. But that's an acceptable answer to me. If you said that they need to come once a week for the next 2 months, I would have a problem with that. Okay. Yeah, exactly. So, I would say something like every other day would be good here. Or I might say something like, two times this week, you know, and then if they don't improve, you know, yeah, reassess something like that. Yeah. All right.
The problem is that I know the point, I know the diagnosis, but I don't know, for example, if I want to put it in writing, I'm awful.
That's why we're doing this. It's challenging sometimes. You have an idea.
That means I know which section, how should I write it down.
Yeah. So one of, you know, part of that, the intro handout that I gave you, one of the things that I emphasize, Sam is the only person in here that's really had me for clinical practice or classes. And, you know, one thing that I stress in clinic, as well as when I teach diagnosis, you know, the course of case studies, right, is that your treatment has to match. So it's always difficult. I find for whatever reason, and even myself, sometimes I have a hard time going right to the diagnosis, right? It's sometimes easier to work backwards. What points are you going to use? What's your treatment principle? Figure that out, and then go back and write a diagnosis that matches it. Well, they have to match. That's my point, is that, you know, your case study should have a cohesive feeling, right? You know, the signs and symptoms must be explained by your diagnosis, and you're explaining them. The treatment must be justified by that diagnosis and the signs and symptoms. So, you know, when you have a hard time at that middle stage at the diagnosis itself, look at this. And that kind of, it's like you have point A and point C, helps you understand point B a little bit better sometimes. If I think in this case, do I want to release wind heat from the exterior in this case or not? No, I'm focusing on phlegm damp, so I can't be doing wind heat at the same time really here. Okay, I'm losing students, so do you guys need another break before lunch? What time do we take lunch? 1? All right, so let's take 5. We're going to come back. You're going to do another case before lunch. Fun? Good. Fun? Fun. Good. Okay. So we're back, case 2. So if illness is dizziness, the pattern, if you say Qi and blood deficiency, I would like you to be more specific about what? You know, this is, again, that very, very broad statement, Qi and blood deficiency.
I put heart in and blood.
Sure. Okay, you can.
It was, sorry, heart, Ian, and blood. Yeah.
Yeah.
Okay. All right. So, you were saying that. So, who said? What were you saying about this being backwards? How would you write that one?
Yeah.
So you would.
I put that deficiency of lean Qi and hurt blood.
Sorry. Blood deficiency. So spleen, Qi, and heart blood deficiency, right? Okay. Well, I'm showing you the contrast here. It's better because it gives me organs to work with. You know, when you just say Qi deficiency, you know, lung Qi deficiency, kidney Qi deficiency, heart Qi deficiency. All right, so, this is not very good here. Qi deficiency should indicate where? I'm going to go to the next one. Liver and heart blood deficiency with liver yang rising. So that's interesting. Now, I would be a little cautious with the liver yang rising bit, because liver yang rising as a pattern, right? If I'm thinking of objective patterns, while it does cause dizziness, it's not usually the same as, so if you look up liver yang rising as a pattern, you see kind of different signs and symptoms than what we see here. Right. And yang rising, though, usually has some heat. and it usually has a kidney deficiency. So liver blood deficiency can give rise to wind, right? Which is more closely related here than the liver yang rising. So, we usually wouldn't use Tiama Gotang in this type of a situation when there's a significant severe deficiency, right? So Tiama Gotang Wan. Is that your main, maybe, I'm not saying it's incorrect. I'm just saying, I'm thinking about it from the perspective of a TCM pattern liver yang rising. Is that what this is? Or is it liver wind from blood deficiency? All right, because usually liver yang rising also has a headache, and what else do we have here? A lot of the signs and symptoms here are not really related to that. Okay, so I'm just cautioning about that. The next one, yin. Show me the sign of yin deficiency. Who said yin deficiency? Okay, is dream disturbed sleep always deficiency of yin? Okay, what other sign of yin deficiency? Temperature. I'm looking for temperature. I was like, really? There's temperature here? Great. Okay. It doesn't confirm it. It doesn't, it is, listlessness is actually like, there's a lot of patterns that could cause it, but based on what we see here, there's not enough to indicate yin deficiency. So again, all right, the only thing here that I'm going to, all right, if I go down to the tongue, it says pale tongue. Normally yin deficiency should be red and peeled, but it says pale tongue with a thin and dry coating. All right, so that's questionable to me. There may be a slight damage to yin now. All right, I still don't, I don't see a lot of heat, which is what I'm looking for with yin deficiency. Yeah. So, all right, this is, if I look at it from a perspective of pattern differentiation, now rather than 8 principles, we say, oh yeah, it's deficiency, great. So what is deficient? Differentiate. If you had to choose a multiple choice question, is this A, blood, B, qi, C, yin, D, yang? What is deficient? Why? Because most of the signs and symptoms, to me, that's most appropriate here. To focus on the blood deficiency rather than the qi or yin deficiency. Because again, when you say the qi deficiency, even if it's spleen, qi, and heart blood, I immediately say, show me spleen deficiency here. Or sorry, show me qi deficiency. Well, there's 1 or 2 signs and symptoms. And I'm not saying that that's an incorrect answer, but, the most signs and symptoms are focused on blood, and blood deficiency is one of the major pathologies that give rise to dizziness. The little wind stirring up, right? So, and what do I say? Why do I say qi deficiency? Well, no, it doesn't. What is the sign and symptom? It's kind of like the yin deficiency. There's only like one. What shows qi deficiency here? What is not so for me, the weak pulse rather than a thin pulse. Textbook wise, strength of pulse is attributed to qi, where the width is attributed to blood. So if I see a thin pulse, fine pulse, right? I think, oh, blood deficiency. If I say thin and weak, well, likely a little bit of qi deficiency. So, most everything else could be attributed to the blood deficiency. It is true that we very often do tonify qi in order to produce blood, but yeah. Okay.
So, sorry, so is it only blood deficiency, or are you saying blood and qi?
I'm not reading the answers yet. I'm asking you why. I'm just going through your answers here and analyzing them. Right, so where did I leave off here? Is that where well, I was talking about the yin deficiency. So yin and blood deficiency of the heart, right? Yin and blood, heart yin and blood deficiency was this one, right? So what we said. So again, similar to what I said about the yang rising, I question. So in my mind as a TCM practitioner, immediately I think of the two patterns, heart blood deficiency and heart yin deficiency, and I think of all the signs and symptoms associated with them. Heart yin deficiency, can I really differentiate here? Can I really say this is yin deficiency rather than just blood deficiency, or are most of the signs and symptoms explained through the blood deficiency alone? All right. Spleen Qi, I kind of just already talked about this. So we actually talked about this in the beginning of class when I was mentioning the Gui Pi Tong pattern, right? That's what this is. So this is the, spleen not producing heart blood is what the pattern is. So the questions that arise for me here, and again, is there spleen Qi deficiency? It's a tough one. This is a tough one. It is, isn't it? The other question that arises for me is that, is there not also liver blood deficiency? You just say heart blood deficiency, so I know I keep on telling you, no, be more specific and say which organ, but also don't be too specific if it doesn't cover what you need. For me, the questions around the relationship between the heart and liver here is that menstrual blood is governed by the liver, right? So it's likely a little bit of both. I mean, we know a lot of the signs and symptoms are heart, the poor memory, the sleeping, this is likely related to the heart. Dizziness really could be related to both of them because it doesn't give any more information. I would have to say, well, this looks like heart and liver. It's more systemic. And the pulse doesn't specify any organ. The tongue doesn't specify any organ. Well, I would say that we have signs and symptoms of heart and liver blood deficiency here. So I'm not saying this is incorrect. Yeah? Well, from my perspective, I would not address, let me think, how do I say this? I don't consider the function of the spleen to be very weak here, which is spleen Qi deficiency. However, how do you tonify blood in major blood deficiencies? You use the spleen, right? Spleen produces blood. So we have to have that consideration in our,
So when we put the actual different syndrome differentiation, we have to put the spleen heart and liver blood deficiency.
So that's right. That's right. Well, I'm going to read his answer, and I'm not saying I agree with it. Well, I mean, you think case studies are that black and white? They're not. So his answer is Qi and blood deficiency, and the syndrome illness, dizziness, syndrome differentiation is Qi and blood deficiency. The understanding here, the underlying understanding is that the primary organ affected is, so if I, again, like I did last time, if it was multiple choice and I said, is this blood deficiency of A, heart, or B, liver, what is the best answer? Heart, right? We should be able to see that. That means when the most important pattern to identify is heart blood deficiency here. That's the most important one, okay? So Qi and blood deficiency, pattern causing dizziness is the last one, spleen, qi, heart, blood. I mean, it's just not specified as much in the way it's written. All right. Now, again, I don't know if I don't think that there's much of a difference between those of you that know herbs and formulas treating this with Bajin Tong, which is tonified qi and blood systemically, right, versus Guipi Tong, which more spleen and heart blood. He uses Guipi Tong, which is the main formula for this pattern. I don't know if I would do that. That's why I said I don't know if I agree with him. I would probably use, but it's still really the same category of pattern. It's still tonifying qi and blood systemically in the body. So heart blood deficiency is the primary pattern, in my opinion here. And the questions, I guess, that there's a little bit of this gray area, whether, you know, the spleen is actually deficient enough that you need to strengthen it with a formula like Guipi Tong, or whether you can just, you know, use tonifying blood systemically. But ultimately, you are going to treat the spleen with acupuncture, so that treatment plan is probably good, and your focus is on nourishing blood of the body, nourishing the heart blood a little bit more specifically. The dizziness symptomatically is a little bit of wind stirring up. So his points, and he uses more, so I'm just going to list his points out, and then I'm going to ask you to choose only 4 of his points and why. So he uses gallbladder 20, right? Do 20. Sorry, I'll say the name. Feng Shi, gallbladder 20. Bai Hui, Do 20 or governor 20, GV 20. Neiguan, pericardium 6. Tai Chong, liver 3. Zusan Li, stomach 36. Pi Shu, bladder 20. Wei Shu, bladder 21. And Tai Shi, kidney 3. All right. So I'm going to ask you to, of 1, 2, 3, 4, 5, 6, 7. He's using 8 points here. I want you to choose 4 only. No, why would you do 26 here? Not for dizziness. Not normal. Sorry. Feng Shi. Okay. Feng Shi. Bai Hui. Neiguan. Right? Neiguan. Tai Chong. Liver 3. Zusan Li. Stomach 36. Pi Shu. Wei Shu. Tai Shi. Okay. So what 4 points of those would you choose? Or, sorry? GB 20? Okay. Gallbladder 20. Why is that your first choice?
This adjusts the flow of qi and raises the qi.
We want to raise qi here. She's got excessive raising of qi. Because it is the main point for the symptoms, right, of dizziness. That's the simple answer, is because that is an important point for the illness and the addressing of her symptoms. So, but he has 2 points for that, doesn't he? Do 20, Bai Hui also for that. So, you know, from my perspective, if I'm asked to choose 4 out of these, I would choose only 1. Which one is better, Feng Shi or Bai Hui here? Why Bai Hui is better? Why?
Because you say cold thing, and she has disturbance. They disturb, startle a lot, like a cold.
Do 20, yeah. That's pretty good. Yeah. Yeah, GB20 is a you know, is a little bit more for clearing. So we always use it for like liver yang rising, liver fire. If I had to choose one, I would choose DO20 because it's more commonly used for deficient conditions and it helps regulate the up and down movement of qi, you know, when we have dizziness related to the deficiency. And again, neither, you know, that's not really something you would be asked to differentiate between, but in, you know, in terms of choosing points and choosing less points, that's how you go about that process. So some other considerations here. I think everything else is good. I'm not sure why he would use bladder 21. In this case, I would eliminate that because I don't see any real specific need for it. It does generally help increase, you know, appetite and qi and blood in the body, but there's no real specific stomach signs and symptoms, so I probably wouldn't include it. Now, I question, you know, the pattern, and he's really, you know, you said liver yang rising here, and he's using kidney 3, which really is you know, but objectively, I don't see any signs and symptoms that indicate kidney. So why would I use a kidney point? If I didn't diagnose it, why would I choose it? So I would eliminate that one as well. Sorry? But this is not bladder 23. He's using kidney 3. I'm asking which of the 4 points that he's using would you eliminate or use? So yeah, Shen Shu, I mean, but the issue is that, okay, so why is he using it here? He's using it because kidneys anchor energy. They're the lowest organ in the body, so they pull down energy. Treating the kidney, whether it's kidney 3 or UB23, doesn't matter. The treatment plan, I really should have another case up, but I don't have this case on file, so there's no, is this actually recording the screen? This is going to be boring. Sorry guys, whoever's watching this. This is case 2, right? Case study 2. So the kidney, I mean, the reason he's using them is to pull down, to anchor down, but I don't really need to do that here. That's a different cause of dizziness. That's the liver yang rising, right? Which usually has associated signs and symptoms of kidney weakness, which we don't have here. I really will I don't have a need to do that point. That's an extra point that may help, and we may choose it. Spleen 6, in my opinion, would be better, and it does that function as well because it nourishes blood, right? We also may choose additional points that I think of would be Gushu, UB17, right? And heart 7, because we do want some focus on the heart. There's difficulty sleeping. Now, I think of Naguan, you know, you can use Naguan here, but I would choose heart 7 instead. All right, and the reason is because the pericardium is a little bit more for clearing, meaning it's the heart protector, right? So it's more commonly used for excess heat or excess conditions of the heart, chest pain, and the rebellious qi, right? This kind of thing. But heart 7 is more nourishing or tonifying to the heart. Heart 5 you could use, but I would use heart 7. So, anyways. Sorry, Shenmen. Yes. Yeah. I'm saying I would use heart 7 instead of PC6 here. Yeah. Sure. But what?
I'm just thinking that it gives a pattern of Shen disturbance.
Heart 7 calms the Shen. So does DO20.
Yeah. Okay.
Yeah. Yeah. I mean, but that's how you have to think. You know, just like you have to say which pattern do you have the most evidence for when you're choosing points. You know, what point covers the most ground of the options? If you can, same thing with the last case with the lung points. Well, you know, this point releases exterior, stops coughing, and treats phlegm. Great. You know, like lung 7 is like, okay, 1 point only. You know, it does have the ability. Sorry? What did I say? Well, if I had to choose 4, okay, do 20, probably stomach 36, probably, what else did I say? I said, well, I listed a few other ones. Heart 7, you know, P shoe is good here, or G shoe, you know, UB 17. Spleen 6, it's really hard for me to say, like, you know, which one is better here if I had to only choose 4. You know, spleen 6 is a very good point, but you know, you're really covering a lot there. Yeah, stomach 36 does have the function of strengthening the spleen. UB 17, while it's gushu, the way that it nourishes blood is by aiding the transforming process, transformation, you know, from the spleen up to the heart. That's how it works. So it has some benefit towards that. So, you know, the question of, you know, spleen 6 would be fine too. What's that? Oh, of course we would, you know. What else might I do? I may do moxa in a case like this. You know, moxa is beneficial, it's nourishing. We want to nourish the system. Okay? Lunchtime? All right. When we come back, we're going to crash through a bunch more cases. I have 7 printed. We've done 2 of them, so we'll do 5 more when we get back, and then you'll have more to practice on your own. But okay, so case study 3. Let's start with, before we actually go in and write down the diagnosis for this one, let's utilize what I started with, the different methods of pattern differentiation. In this case specifically, is this an internal or external pattern?
External.
Exterior or interior?
Exterior.
Is it exterior? It came from the wind?
Yeah.
It's internal? Okay. Now you explain to her why you think it's internal. You explain to her why you think it's external, using nothing but the signs and symptoms as they're written in the case.
Well, from one turn the other.
Well, that's
Yes, so I get all that. It might be internal, yes.
Why is the cause external?
Because come from the explain that she was outside, outdoor, I guess. Barbecue is outdoor.
It says 2 days after returning from the barbecue.
Yeah. So she was outside.
So this is a little bit ambiguous. I mean, I'm asking this question because I'm also pondering it. All right. There's two major approaches here. You brought up the point because I at first thought it was external. It's my assumption, but I realized I read it too quickly. I thought it was saying 2 days ago after returning from a barbecue, but actually it says 2 days after returning from the barbecue. That could have been 6 months ago, for all we know. Not likely, but the point is that the barbecue by nature is an intake of a lot of heavy, greasy foods. And so I had to go back and, rethink about this. Is this external or not?
Too much.
Okay. That's right. Yeah. So at any rate, there is a good question here. My approach to answering that question is, are you releasing the exterior in your treatment? What is your treatment method? Are you going to use points that are designed to release the exterior of the body? That's how you can go back. So let's leave that one for now. Is this excess or deficient? Everybody agrees on that one, right? Okay, so that's the point. Let's find the hard issues. Heat or cold type? Okay, good. Now, according to the 6 pathogens, what would this be? If it's an excess condition, it has to be excess of something. So what is in excess? Heat or damp heat? Phlegm? Heat or damp heat? Which one? Where are the signs of phlegm here?
Yellow discharge.
That's not phlegm here. Damp heat. Damp heat is the correct pathogen that we want to think about. Is it a heat type? Yes, but heat would not produce the discharge, would not produce a heavy feeling in the head, a slippery pulse, right? Damp heat is the correct pathogen. Now at this point, kind of see how we're working through here. At this point, you can explain actually the majority of the signs and symptoms already. Any vital substance issues? Any problem with chi, blood? So that's the only thing you would want to consider, right? Because we learned sharp pain is a major sign and symptom of blood stagnation. Is there blood stagnation here? Would you move blood? No. So this is an exception to that textbook, sharp stabbing pain equals blood stagnation. We always think that. This is actually, there is no issue with the vital substances beyond the effect of the pathogen obstructing chi and blood circulation. But we are not likely to address it from the treatment perspective of move chi, move blood here. We just get rid of that obstruction. Okay, what organs are involved? Liver? Anything else? Gallbladder? Okay. Anything else? Kidney? Why? So does that mean that it's so notice how I separated organ involvement. I mean, so because we learn in foundations of TCM that the ear is a sprout of the kidney, does that mean that every ear disorder is related to the kidneys and that we would treat the kidneys? No. There's one other major thing that we have to look at, especially in this case. Sure, deafness, right? Deafness or hearing loss, in some cases tinnitus. These are related to the ears, but what is the other major pathology? We have to, what meridians are affected here? Best answer is Shaoyan, which would include Sen, Jiao, and gallbladder. All right, and this is part of why those ear patterns are often connected here. Okay, why is it important to add Sen, Jiao here? Right? Well, because most of the points that we would use, not most of them, but I would say that we would frequently use points to treat this disease, which otherwise doesn't normally, we don't see any specific Sen, Jiao organ involvement with these points because it is the Shaoyan and because it wraps the ear. So essentially it's a way of addressing the symptom and the chief complaint here. Okay? So now that we've done this, do you want to rewrite your diagnosis? No, you're good. Okay. So then, really and this is another way of doing it. When you're doing the exam, if you feel stuck, you do all the diagnostic, differential diagnosis methods separately and look at everything objectively of what you have left, right? And this can sometimes help you form everything in your diagnosis better. This is what I'm doing in my head, even if I don't write it all down. So, this question of internal versus external, the way this is really explained maybe has to do with this last part of we have organ involvement. We do, right? We have signs and symptoms of organ involvement, bitter taste in the mouth, and a pulse that is not floating and a thicker tongue coating. It looks like it's a some organ involvement, all right? But there's also the channel. Remember I said the channels are generally, when they're affected, it's often exterior in nature. So, okay. Right, it's a little bit complicated. I will go back to the treatment principle. I'm still leaving this until the very end of this case to answer it. But this is one thing to consider, why it appears as one thing, and it might not be that. Okay. All right. So what's the diagnosis? Sorry? Yeah.
Earache.
Oh, illness is earache. Sure. Earache, painful ear.
Which of the same from
Okay.
liver damp fire.
Liver damp fire. Okay. Not damp heat, damp fire.
Well, you can say, well, there is.
Are they the same or are they different? Usually, yeah.
Is your fire you have heat?
No, is it damp heat?
Damp
fire?
Damp fire?
Normally we won't see damp fire. I'm sorry, I want to waste time with this. Normally we won't use that phrase damp fire. Fire by nature, we use that to describe more severe heat cases where there's drying up actually. So almost never you see the term damp fire. You usually see damp heat. Okay? All right? Liver damp heat. Damp heat, okay. Does anybody have something that's worded a little bit differently? Okay, so now you're indicating it's a channel. Damp heat in Shaoyang. Okay. Go ahead.
Heading due to obstruction of liver gain.
Okay. Somebody else, right?
I had wind and damp heat attacking the exterior of the liver gallbladder.
Okay. Anybody else? Something different? Something that you don't like that's written up here? So say louder so we can hear. Go ahead.
Exterior wind heat.
Exterior wind heat. Okay. That's it? Okay. With phlegm? With phlegm. Okay. So again, now if we take this and I go through some of these signs and symptoms, male 36 means what? Well, in general, we can say he's more young in nature, he has more energy. All right, liver damp heat's pretty narrow. In most of the textbooks, we would say liver and gallbladder damp heat. All right. Normally, the damp heat is not affecting only the liver when it's not affecting the gallbladder, and specifically here, we will see because it's the ears being affected, it's gallbladder channel. We would want to associate it with the gallbladder. So even if we say liver and gallbladder damp heat. All right. Damp obstruction of the upper jaw. Damp obstruction of or in upper jaw.
And then there's fire in the stomach. And the transfer with GBSA. And then, and then
Whoa. okay, hang on a second. So stomach fire transferring to the sand jowl. To the gallbladder or sand jowl? To gallbladder? To gallbladder. All right. All right. So.
No, I think it's that side of heat also really run the gallbladder.
Okay. Yeah. So.
And then it's like right now.
Dan, I'm going to just write this. Dan, because nobody said this specifically. All right. Damp, heat in liver, gallbladder. Okay. LRGD. Okay. So, again, just saying liver damp heat, maybe a little bit confining. Damp heat in the Shaoyang. This is interesting. So we would often, what I would take this to mean is that it's a channel problem and it's not internal so much. The headache due to uprising of liver yang is not is not taking into account the signs and symptoms of dampness. So if I asked you this, I would say, or if you wrote this down, I say, well, why does the headache feel like a wet towel wrapped around the head? Well, that's a sign and symptom of dampness or damp heat, summer heat. So the fact that they have this, but you're not addressing the dampness. And then I could also say, well, why is the pulse slippery? Right? Why is the tongue have a greasy coating? None of those are normally present with yang rising, and the yang rising doesn't show this. The other question here is that you specifically said headache due to, and so we're differentiating this specific illness of ear pain, because it's an ear pain and ear infection is actually a different disease, illness, TCM illness, than a headache. So we should make that distinction, okay? Wind and damp heat attacking the exterior with liver gallbladder heat. So this is also interesting. This is not too different from, a combination of those first two options, damp heat and liver and gallbladder, with damp heat attacking the Shaoyang versus damp heat attacking the exterior. Shaoyang is better because it's more specific. It tells you what channels. When you just say it's attacking the exterior, actually it doesn't specify what area is being affected. And if you look up like summer heat attacking the superficial level, you're going to see slightly different signs and symptoms. Although if you're reading CAM, the yellow book, Chinese acupuncture mock combustion, this would fall under the category of damp heat attacking the upper jiao. So whoever said that last one, right? Damp heat obstructing the upper jiao. Okay, liver gallbladder heat the same. Now, the only thing that I would question, and this still goes back to that first thing, if you say wind and damp heat attacking exterior, looking for those exterior signs and symptoms. I'm kind of looking for them. I'm going to treat by releasing the exterior. Okay, want to just consider that. External wind heat with phlegm. So wind heat, right? What are the major signs and symptoms of wind heat? Well, we don't, again, it eliminates the signs and symptoms that we have of dampness, the feeling of the towel wrapped in the head, the greasy coating on the tongue, and the slippery pulse. Now, slippery pulse and greasy coating could theoretically be explained by your phlegm here, all right? So I get why you're thinking that, but see why I did this in the beginning? So which of the pathogens is most appropriate? And I know that there's 6, and then I said, well, phlegm is really another one that you can add on to those 6 when you're trying to figure out what is in excess. The best, based on the signs and symptoms that we have objectively, is damp heat, not phlegm here, right? Because we don't have any other signs and symptoms with phlegm. Clear? All right. And normally, wind heat with phlegm is really like wind heat with sore throat, fever, cough, you know, some phlegm present. All right, not this ear infection is generally not seen as that. We don't transform phlegm in most of these situations. Clear? All right. So the correct answer.
We didn't catch that. Because
No.
the yellow discharge flowing out.
So
damp is natural, but the phlegm is something.
Damp heat. No. The yellow discharge in ear infections is not the same as phlegm in most situations. Yeah. A reason I keep on adding that little like caveat in most situations is because when it's in certain cases of pus, purulent discharge, we may consider it phlegm, but there should be other signs and symptoms. So basically what I'm, you know, in this case, because damp heat is a better answer because it explains more of the symptoms that they have. There's more signs and symptoms. And then I don't need to talk about phlegm. I don't need to discuss phlegm. I don't need to, because I'm dealing with damp heat and I'm addressing all of their signs and symptoms through that treatment method. So, you know, whereas if I say phlegm, then I still have these things, well, what about the heavy headache? What about the, right? These other signs and symptoms that don't quite match, right? Sorry? Better with the damp here, yeah. Okay, so TCM diagnosis. So the illness is ear pain, Ertong, right? Syndrome differentiation is damp heat from liver and gallbladder invading the upper jiao, upper energizer, okay? Now, I'm gonna suggest, you know, in terms of wording, that I would actually be, you know, this alone, damp heat in liver and gallbladder, really combined with, you know, some phrasing from this here is also just fine. So if I say damp heat in the liver and gallbladder affecting Xiaoyang, obstructing Xiaoyang, right? That to me is fine. It's really saying the same thing. As you know, in this case, the upper jiao that's being affected is mostly Xiaoyang. Now, the heavy headache is part of why they say the upper jiao, damp heat basically attacking the upper jiao, right? You know, I would probably be okay with this wind. I don't know about the wind bit here. It's a little bit confusing. Damp heat attacking, and I think I said I would rather than attacking exterior, I would say attacking upper jiao or attacking the Xiaoyang or something that's a little bit more specific, and liver and gallbladder damp heat. Not heat, damp heat.
Can you read those again?
Damp heat from liver and gallbladder invading the upper jiao, upper energizer. Okay. So the phrasing is interesting, and we can talk about, again, it's that question, and I'm not sure, I'm not 100% sure whether it's like an English language kind of subtlety here, you know, saying damp heat from liver invading the upper jiao, and that question of whether this is internal or external. Was it caused by the food he ate at the barbecue, or was it caused by exposure to something at the barbecue? I can't actually answer this question for you. All right? I mean, I can't tell you with 100% certainty. Okay? So what is the question, you know, again, if we go to this internal external question again, what is your treatment? Are you releasing the exterior in this case? Okay? You know, it is both internal and external. All right, we have signs and symptoms of both internal and external. So, treatment principle. What is your treatment principle? If, given the diagnosis I just gave you, or what we've talked about so far, who would like to tell me a diagnosis, treatment principle? No, treatment principle. Clear heat, damp heat from liver and gallbladder. Usually diagnosis and treatment principle just parallel each other 9 times out of 10, 9.9 times out of 10. Yeah. Okay. You know, we may do that. So I might say add something, because just clearing from the damp heat from the liver and gallbladder, that's a primary thing that I hope everybody got to, regardless of everything else. Would be clearing from the channel a little bit as well, right? Yeah, we could. I might use a phrasing, something like clear damp heat from Shaoyang, or clear the Shaoyang, or clear. Yeah, I would probably say something like that. Dredge the qi. Dredge the qi from Shaoyang. Yeah. Yeah. You know, this idea, like, what's happening here? We have Sanjiao and gallbladder obstruction, and basically what we're trying to do is get that damp heat to clear out of the meridians as well as from inside. And that's the treatment method. That is going to be how we're addressing the pain itself. Okay? Points, what are major points? Who would like to tell me your 4 points? Sorry? TB? Okay.
Gallbladder 2. Gallbladder 4.
Good.
LI4.
Okay.
GB.
Well, that's 4. So does anybody agree, does anybody think that there's one of these points that you would rather switch with another one? Gallbladder 4? Gallbladder 4? GB4?
No, GB43. GB2.
Sure. That's what he means. Small SM19. Okay, yeah, I mean, addressing the ear pain itself. I mean, gallbladder 2 is doing that. I mean, so if I had to use 4 points, we said Shaoyang, so Sanjiao or gallbladder here.
17, GB2, GB43,
yeah.
Sanjiao 3.
Probably liver point too.
Liver 4.
Liver 2, liver 3. Yeah. Okay, liver 2, liver 3. What else did you guys say? Sanjiao 5, yeah. So actually, this is the one thing, as opposed to LI4. Why are you guys using that? Sanjiao. Yeah, it's triple warmer. Sanjiao. I use Jiao because warmer, energizer, and burner are kind of weird translations of the term. So in certain cases, I stick with the pinyin.
LI4 for the headache.
Sorry?
LI4 for headache.
LI4 for headache. So that's my question. I mean, yes, we use it for headache, but that's not the chief complaint. B, are there we're already doing other points that should be resolving it. So actually my preference would be to shift that for a Sanjiao point, whether it's Sanjiao 5, or we would likely use, 2 or 3, right?
Sanjiao 3,
Yeah, 2 because it's a yin spring point, so it's draining and heat clearing. I like that point. That's a Sanjiao 5 is kind of a command point for the the outer, and I would think of, and any three of these would be, in my opinion, a better replacement for Li4 for this case, because you're addressing the chief complaint, which is ear pain, which means you want to use points on the meridians that go to the ear. So the most important ones, certainly I like gallbladder 43 is one of the most important ones because it really drains that Xiaoyan down and it clears the heat out. There are other points that you could use that are appropriate. For example, gallbladder 34, gallbladder 40, could be used. 41, right, combined with Sanjiao 5, we could use gallbladder 41 as a point pair. Liver, we may use. I would probably use liver 2 if I was going to choose a liver point. Liver 2 or 3 would be okay. And we actually covered most of the points that he listed. Sanjiao 17, gallbladder 2, gallbladder 43, liver 3, Sanjiao 3, right? So similar group of points.
The 4 bases, gallbladder 43, Sanjiao 17, Sanjiao 3, and one more.
If it was me and I was choosing 4, that's a good question. So gallbladder 2, gallbladder 43. I don't know. I mean, if I had to choose 4, I would probably stick to Sanjiao 2 instead of Li4, and then these are good. Gallbladder. I mean, I'm not sure. Maybe I would switch gallbladder 2 with the liver point, but the only real liver symptom here is the bitter taste. And we see bitter taste with other gallbladder, like damp heat in the gallbladder. So, I'm not real concerned about addressing the liver meridian or liver organs so much as I am the gallbladder, right? Especially with the acupuncture. Remember, acupuncture has a more direct effect on the meridians anyways, right?
If when you put treatment principles, don't you want to choose like ones on the feet, ones on the arm?
Generally speaking, we often do that. We often want at least one point on the arm, one on the leg to kind of harmonize the limbs. We kind of say something like that. And local, most situations you use at least one local point. I don't think you're constrained to 4 points. So I don't always do that. It's not a rule. It's not something that you have to do. And certainly in like exterior wind, I don't always choose a leg point. If everything's up here, I'm just trying to venting out from up here and choosing mostly the the arm, upper limb points.
Figure out how to examine
Yeah, I mean, there's no TCM rule that says that you must have points on the 4 limbs. Okay, and now keep in mind there are different approaches. I mean, we're focusing on like the major ones, but if 4 needle technique, for example, you could choose points based on another diagnostic principle. You could say, well, I'm tonifying these 2 points and sedating these 2 points based on this diagnosis and this theory. I wouldn't do that. I wouldn't use one of those outlying ones. I mean, mostly stick to basics. All right. Any question? Okay. So the last thing was the herb. The herb formula that is prescribed here is a modified Longdan Shigantan, which is a primary formula for damp heat in the liver and gallbladder. You may modify it. Let's see. I'm just looking for any major modifications, which I don't see anything that's really that significant here. So this now I'm going back to that initial question, is this internal or external? And because of the formula that's used, primarily is internal, because the formula does not release the exterior. So the assumption over the whole case, as we look back on it, is that the damp heat is both, there are signs and symptoms of exterior, and when we use acupuncture, we are addressing, by addressing the Shaoyang, i.e. Sanjiao channel meridian here, we are clearing wind from the exterior of the body, but the primary pattern is more internal than it is external. So if you had to choose between the two. Clear? If it was one of the two, it would be internal. That's what, yeah. It's more damp heat in the liver and gallbladder is the most important. Just like last case. Sorry?
You didn't use any liver.
Yeah, interesting, huh? Because, yeah, well, you could say damp heat in the gallbladder. Because that's the standard pattern, right? So in Machiocha or HB Chem, when you look at the pattern, it always says in the liver and gallbladder, right? But in this case,
it's not better if it's 1 point for the liver too?
You could. I mean, I put liver 2, liver 3 up here, but for me, because I don't see, the reason I don't is because I don't see any objective signs and symptoms of liver specifically being affected, right? And the reason that I'm using the diagnosis, which what I said already earlier is that can be, because what is it? Bile, right? That's gallbladder, right? I mean, that can be present from gallbladder. So from my perspective, it's not a treatment priority for me to focus on the liver as much as it is these other channels. But by all means, yes, you could use one liver point as well. Does that make sense? So if I had to say one or the other, I would say internal. If you can debate these questions, then you're on the right track. Right? Hopefully you don't have to get this level of specificity. All right. Next. Ready? All right. Moving right along, right? So, case study number 4. Male, 27-year-old, manic depression. All right. Main medical complaint is headache or hot sensation. I'm not sure why it's an or there. But main signs and symptoms, overexcitement, insomnia, fast talking, right? What does that indicate to you?
Excessive energy.
So what's that? So too specific, right? Overexcitement to me is like a yang condition. Insomnia and fast talking, right? Again, it gives the idea, the overall picture of hyperactivity of yang. And specifically fast talking indicates heat. So when we say overactive yang, I mean that's what I'm immediately thinking. Oh, there's excess of yang and heat in the body. All right. We haven't got there yet. Avoiding work, being tired, fear of failure when he's depressed. So we have this picture of some mental, or the other thing that we can see right away is that Shen is being affected. So depression, manic, Shen, yeah. Main signs and symptoms, insomnia. All right, so we know insomnia. What do you guys think of first with insomnia? Kidney deficiency, huh?
No, not here. I was thinking about old people and they have. Sorry.
Sure. Yeah, so there's some kind of lack of rooting of the Shen. There's several patterns that can lead to insomnia. One would be kidney yin deficiency, right? Is a common like old age. But is this a kidney yin deficiency? Definitely not. Heart fire is another big one, right? That we think of, but also heart blood deficiency, right? Heart blood deficiency. We often have insomnia. Insomnia is not. It's not really clearly outlined here what type of insomnia that person has. You know, are they falling asleep okay and waking at night? Are they, you know, staying up, you know, agitated, unable to fall asleep? That would help us a little bit, but right now we know. Oh, there's nothing showing that here. Right. But I'm just saying that I have that openness in my mind. I won't say insomnia is yin deficiency, right? Okay. Inappropriate laughter to you indicates what? Okay. What else? What's more, you know, what else can you tell me? Shen disturbance, but specifically laughter. Say again? Heart, right. So, you know, specifically it is from the Nijing. I mean, we're really talking about laughter is the sound of the heart. So it really is helping us indicate not just the Shen disorder, but specifically some heart involvement. Excuse me. Irritability, okay, and fast talking. Information collected includes red facial complexion. So based on how that is this empty heat or full heat?
Full heat, excessive heat.
That's the way it's worded. It says red facial complexion. So, you know, normally we would expect like rosy cheeks or some kind of red spots in the face if it was empty heat or yin deficiency. Loud voice also indicates excessive condition. Fast talking, talkative again. Irritability, delirium, agitation, heat, Shen disorder, okay? Red tongue with a thick, greasy yellow coating, also indicating heat, excess or deficiency. Excess because of the coating. Forceful, full pulse. Okay, so what is the illness here?
Heart fire, liver damage,
What's the illness? What is the So now I know you guys are just
The main complaint is headache or hot sensation.
Yeah. So so I would say headache if it's a little bit, you know, I would either you either say kind of like Shen disturbance, or headache is a little bit tricky here because there's no other informations that they give about the headache. Yeah. So he has manic depression listed as the disease. So, you know, this is the type of Shen disorder that we're talking about.
So would you put in my case, I will try to use the Chinese name.
Yuzheng, Y-U-Z-H-E-N-G, Yuzheng. Okay. Yeah.
So that will go
But
on the whole thing.
Zhang Zhao. Okay. So what's that? This says Yuzheng. Yuzheng. Okay. Yuzheng. Okay. What does that mean in? But what is Yuzheng? What does that mean?
That means you as depressed. You only be
Yeah.
depressed. No, it's not. But exciting. So here, yeah, exalt is exciting.
Go ahead. Yeah, that's what I'm curious.
The full 52 diseases include
Okay. Manic depression.
anxiety, depression, and stress.
Okay.
So it's global.
Yeah, so this is that's why I was going to be a little bit cautious. He says manic depression,
We just
and
mentioned manic depression.
but no, my concern is that is a Western diagnosis. That's a real specific thing. You jump. Yeah, that's right. That's what I would suggest. Okay, moving forward. What is the T? Okay, let's go through this. We said this is internal or external?
Okay, finally.
Excess deficient?
What is the diagnosis we have to write?
I already said twice.
No, can we write it down because that's not.
You'll have all the answers. So talk to them. You're going to get all of the written answers.
Okay.
Yeah.
Okay. Excess and heat.
Excess and heat. Good. Is there a pathogen present?
Heat.
If you say it's excess, what is in excess? What's there too much of?
Heat.
Okay, anything else? Oh, phlegm, why?
Well, for the greasy tongue and the
Tongue, yeah. Right? Greasy tongue coating, but more specifically, it is the pattern that we're addressing, isn't it? Because heat won't cause the same level of mental confusion. Okay? Anyways, we'll get to that in a second. Is there any problem with the vital substances? Again, no, not in this case. It's excess in nature. What organs are affected? Anything else?
liver.
What signs and symptoms of liver are there? Can't that also be a sign and symptom of a heart condition? Headache? Okay.
Depression.
But again, it's to me, it's not. I don't see a lot of objective signs of liver. While there may be some, it's not. I see no specific reason to write down that the liver's being affected, because everything you guys said. Sorry.
Because of the hyperactivity of the liver yang.
What do you mean hyperactivity of liver yang?
The headache.
The headache is the only symptom, and so when you learned Chinese medicine, you learned that headache means the liver is affected? Well, no. But no, I mean, all you know is headache. All it says is headache. So does that mean the liver yang is rising? Does it mean that? No, it doesn't. It doesn't. I mean, you can't say just because there's headache that indicates the liver. If the pulse was wiry, I would say, okay, now you're onto something. You have more than one sign and symptom leaning towards liver. Irritability is listed as under any heart heat pattern. So from my perspective, no. There's no reason to say liver here. You don't need to address the liver. That's not the main focus. All right? Are there any meridian involvements that we have to? What is the kidney here? No. No, there's no meridian involvement here. There's no specific channel syndromes that we're dealing with, unlike the last case. So we don't need to deal with this. So now that you have this, what's the most appropriate diagnosis? This is actually a textbook case, right? Phlegm heat or phlegm fire, you can use either or. Phlegm heat, misting, heart, right? This is a very standard TCM pattern. This is the reason why I can say with a good amount of certainty that you don't need to address the liver here is because this pattern will encompass pretty much all of these signs and symptoms. Remember what I said in the beginning, sometimes there's a red, what we call in English a red herring, something that's meant to like send you off in another direction. And that's what a trap would be here. Oh, this is liver, irritability and headache, right? You could say the Shen, phlegm, heat, misting the Shen. Yeah, I mean the normal terminology of the patterns, phlegm, heat, misting the heart, which, you know, calming the Shen will become part of your treatment principle, but the pattern itself, usually we say phlegm, heat, misting the heart. His terminology, just for comparison, is phlegm, fire, harassing the heart. Same thing. Okay? Same thing. So, what's your treatment principle? Clear heat. Clear heat from the heart.
Oh, yeah.
Phlegm. Dissolve. Transform. Let's transform it. Okay. Now, sometimes in here, we don't need to put it in this case, I don't think, but we also sometimes, if the patient goes into like, you know, real extreme states, we may also say open up the orifices. You know, open up the orifice of the heart, kind of use I don't know, sometimes we use these acrid aromatic herbs that, you know, open up the heart in cases like this. But here I think that's fine. Calm Shen. There's just an arrow there. Makes it look funny. Calm Shen. All right. Okay, what are your points? Do 20, okay. Heart 7, okay. Heart 9. So 9 or 8, why? Yeah.
Heart 7?
Clears heat. Heart 7, we already said. PC4, why PC4? Why PC4?
These 2 point combination is open up the orifice, and it causes heat, and it's sort of like a standard combination.
Usually PC6, Niguan you mean? Yeah, PC6 spleen 4. Okay, all right. I wouldn't think of using that in this case because there's, at least from my perspective, there's no Chongmai disharmony, so we don't have chest pain, which would be the main indication for looking at that. Still use PC6, but I probably won't use the combination points, although you could, you know, there's some benefit to looking at the spleen with the phlegm. But why? What is the kidney? We didn't say kidney. Why do you love the kidney so much? I love my kidneys too, but why are you going to treat the kidneys here? You only have 4 points. You're wasting a point that needs to be used somewhere else on the kidney. No reason to use kidney. For what? What signs and symptoms are there of kidney involved? There's nothing. UB15, sure, you could use. Why? Yeah, stomach 40. I would use. Now, there's there's quite a few possibilities of points that will open up the heart and pericardium. You know, heart 8 would be, you know, PC6 is probably a more commonly used point for this condition. I mean, real textbook kind of point here, Niguan by itself. And here, in contrast to the blood deficient case, you see that now I'm saying, yeah, let's use the pericardium because it's an excess condition. The pericardium helps to vent and open that excess that's already there. I think stomach 40 is important as well because phlegm heat, you know, this is a major thing. So, you know, you also said UB 15 because of the heart. You also have DO 11. Also is a point that can clear heart heat, right? So, you know, on level with the UB15 there. Anything else? What else?
What about the small intestine 3?
SI3? Why?
Why?
Why? I don't know. You gonna write that down? SI3, I mean, we normally, I don't think of it as a calming point normally because the sensation is so strong. I mean, I don't think of using it here. DO 20 you could use as a Shen calming point. However, I prefer, you know, either DO 24 or Yin Tong in these types of cases, all right? I prefer those to DO 20 because, well, you could use DO 20 as well. But these have a slightly more Shen sedating, and because he's hyperactive, in clinic, I would use some points specifically to sedate or calm the Shen. Either one of these would be good, or DO 20 could be used as well.
Would you use like part 1?
Part 1? Not normally. Why?
For the headache relaxing.
I would say maybe.
Well, let me answer his question first. LI4 functionally can clear heat. I generally, sometimes, I know that I said there's no liver involvement, and that's because I'm trying to teach you. Because if you don't identify phlegm fire harassing the heart, then don't even worry about that. But in clinical usage, we may use a LI4 liver 3 combination, or something like that, because of the overall nervous system disharmony that these types of patients exhibit. So, clinically, we may address the liver a little bit here, and I may use LI4, but I generally, the caution would be that it's a strong moving point, and he's already hyperactive and moving too much. So I would think that pulling qi down, draining down would be beneficial in this case. So some other points that are listed besides what we've already put up here are DO 26, okay, for Shen calming. I personally wouldn't use this, but go ahead.
I've seen a case in Shanghai University. Professor treated I've seen a case using Zhigo, sometimes using.
What is Zhigo?
Zhigo SD.
Sanjiao. No, that's Waiguan. Sorry? What meridian? Which meridian?
It is on
SI3. Sanjiao? Okay. Show me. Point to the point. Just point to it on yourself. Point to where the point is. Okay. All right. At any rate, I don't want to spend time talking about random cases in Chinese hospitals because there's lots of cases to discuss. So the other points, the DO 26, which is I'm just going through his points. So, and the idea of SI3, now notice I didn't say that you couldn't use it. I said, why are you going to use it? And you couldn't answer me very well. But it doesn't really have, it doesn't have Shen, calming the Shen is not listed as a function of that point. So the reason you could use it is it does adjust the Dumai and is used for yang conditions in certain cases. But really, normally we wouldn't use it here. This is part of the same reason he's using DO 26, because it's a termination point on the Dumai. So the fact that it, kind of opens up this sea of yang channel. I don't personally like to use it that much because I find most patients don't like it. But anyways, heart 7, I already said yin tong, okay? And liver 2, liver 3, all right? One or the other, right? Are being used here. All right, so liver 2 or liver 2 and liver 3 can soothe the liver here. Oh, sorry. No. He has that. Yeah, I agree. So from my perspective, I wouldn't choose it out of 4 points, but he is listing 7 or 8 points for each case. So like I said, in clinical usage we would very commonly do it, but we're not diagnosing it as a liver pattern here. We're not, the treatment plan for phlegm fire harassing the heart is, it's really to degrees. If you see liver sign, you commonly will see liver signs and symptoms, but you should usually see them in the case, so a wiry pulse or whatever. All right. Okay. Oh, we have lots of cases. I mean, we have no shortage. I have 7 printed. So case study 5. All right. What is the illness here? Neck pain. Yeah. Okay. All right. What is the pattern?
It is a wind.
Righty. This is interesting, isn't it? All right. Internal or external?
External wind.
Internal. Why is it external?
Because for the pillow, he wake up in the morning and most probably bad position of the head because of the pillow.
But before I deal with internal, external, what is the cause, which is what you just said, right? It's not necessarily why it's external, but that is the causative factor, is the likely related to the sleeping position, although we don't know that 100% because it doesn't say, it just says woke up with it. So what I'm just putting this out there in your mind, it's possible that while sleeping she was exposed to some wind cold through an open window or something like that, although it doesn't indicate it. So I would operate under the assumption that happened when waking up, it's probably related to the pillow, which probably means what? The onset is almost like not so much B syndrome as yeah, but it is a painful obstruction. But what is what happens when you have that poor sleeping position?
Stagnation of chi.
Stagnation of chi and blood is what I was getting at. I mean, really, that's what happens. That's the causative factor, is basically poor posture or poor positioning for a long period of time, stagnates the meridians, which then stagnates blood. We may have skeletal, cervical misalignments, but we have nothing to support that right now. So that helps us get somewhere, right? So in terms of whether it's internal or external, well, we should be clear that, well, it's a channel problem rather than an organ problem. However, there are no exterior pathogens. There's no presence of an exterior pathogen in the context of a cold or flu, right? So we should be a little bit mindful of that differentiation here. Okay. Is it excess or deficient in nature? Are there any signs of deficiency?
Yes.
What?
No. Because of the tone with the white pulse, floating point, and weak pulse.
Okay, so yeah, that's correct. With a weak pulse, I wouldn't say that the pale tongue is super definite. You know, it's not enough by itself. If it was just pale tongue, but if I see pale tongue and weak pulse, I'd say, yeah, there's some underlying weakness, some deficiency because we have so little to go on. Okay, 61 years. Yeah, age. All right. Is there an excess? Is the condition excess or deficiency? Why? Tight pulse and floating. Yeah, okay.
Pain upon pressing.
And pain upon pressing. That would be a key differentiating factor indicating an excess. Okay? Muscle convulse with obvious pain upon pressing. So that gives us clear information about the nature of the pain being excessive, which it usually is with qi and blood stagnation. So, you know, the illness, and remember all that stuff I talked about at the beginning of class, primary pattern versus secondary pattern. Yeah, maybe she has some qi and blood deficiency, you know, hey, right? She's 60 years old. Okay, but we don't have a whole lot of symptoms of it, just a little bit of that weakness. Okay? Do we have any clear signs of, oh, sorry, what pathogen? Is there any pathogen involvement here? Tell me why. And? That doesn't show it. Okay, but that's still not telling me why you think there's a cold pathogen. You say there's cold. What other signs and symptoms indicate? But that doesn't indicate cold pathogen, right? So what are the signs and symptoms? Because pale tongue and white coat can be qi deficiency or blood deficiency, right? So that's why I'm saying it doesn't indicate cold. What else indicates cold? Tight pulse, what else? Floating and tight specifically, right? Okay, and neck pain actually is a major sign and symptom. Pain in the nape of the neck is a major sign and symptom of wind cold, isn't it? So in this situation, we have that combination of a floating tight pulse with pain in the nape of the neck. So it's saying, huh, it's interesting, isn't it? Okay. Do we have any clear signs and symptoms of any vital substances? We do. Which ones? We already said, right? We already said that there's possibly what? Stagnation of qi and blood, okay? It's possible stagnation of qi and blood. Now, we don't have tons of signs of it. You know, we don't have a purple tongue. We don't have a choppy pulse, okay? There's not like but it's only, you know, yesterday morning that it happened, so it's really acute. Okay, we don't see a lot of those signs internally. Okay, organ involvement, any? Liver, young, rising, kidney.
She's old, maybe.
That's an assumption, though, right? So that's a meridian. So that's not an organ involvement, but what meridian is possibly involved? Gallbladder meridian or urinary bladder meridian? It's difficult to say because they don't give us enough specific signs and symptoms. Like they don't tell us that. They say the nape of the neck. It's kind of, you know, that is a term that we often use in Taiyang syndrome, indicating urinary bladder. But they also say difficulty with the turning of the head and tilted towards the hurt side, some part of neck muscle convulsed with obvious pain. So they don't really indicate, but we know more or less that it's going to be either Taiyang or Shaoyang. And if it's neck pain, it's one of those, it's in this region. So, the Taiyang, the qi and blood stagnation is where? In the Taiyang or Shaoyang region of the neck. Okay? It's not in the Yang Ming, because that's throat area, right? I mean, that doesn't give us this syndrome. Okay? It's likely Taiyang. Because that region covers the vertebrae itself, doesn't it? All right, so what's your diagnosis? Okay, anybody have something different? Oh, okay, so which one is better? Sure.
If you put down like invasion of wind, cold, stagnation of qi and blood, like you put all that down.
Sure, you can put all that down. Yeah. So go for it. B syndrome, painful. I mean, we already said that B syndrome is an illness. All right. B syndrome is also related more to damp. This is more. We usually use. Sorry. Yeah. Yeah. Normally B syndrome is more chronic. I mean, sometimes we use it for this type of pain as well, but mostly we're using it to indicate like a more arthritic type pain. I would just call this the neck sprain. The Luogen, what is it? Neck sprain. All right. So I didn't hear you guys. You guys evaded the question. Which is the better answer, or is it both? You think yours is better? Yeah.
I like wind, cold, and the neck causing stagnation.
Okay. All right. So from one thing that we should consider is the treatment again, right? So the treatment plan or treatment principle. How would you treat this with acupuncture? Before I show you the answers, how would you treat this with acupuncture? Would you use the principle of releasing exterior and warming up the Taiyang, right? Or would you use systemic points to move qi and blood? So you're saying, yes, I would use the principle of releasing exterior, but you're the one that said qi and blood stagnation. So
I would use both.
Okay. All right.
Yeah, I will combine.
Yeah, you use both. Okay. All right. So in this case, even though the onset leads us to believe that it's qi and blood stagnation, the nature of the signs and symptoms and the treatment method will lean a little bit towards this wind cold attacking Taiyang. Okay. So here, if you look up on the board there, I actually have the answers up now. Illness, neck strain. Neck was invaded by wind cold pathogen leading to unsmooth flow of qi and blood. All right. So his perspective is that it was wind cold causing it. From an objective perspective, it's a little difficult to say that it was wind cold causing it. Or, as you said, how did you phrase it? Qi and blood stagnation leading to vulnerability to wind cold or something like that. A tight pulse could be stagnation or pain as well. And there's no real symptoms of cold, which is interesting. So they don't feel cold. They don't, it's not cold to the touch, cold to the palpation. The other thing that happens is that qi and blood, when they don't circulate, we don't get yang or wei qi circulation, so we can have mild signs and symptoms of cold with qi and blood stagnation.
I have the cold, evil, attacking qi and blood stagnation.
Cold, evil, attacking, causing qi and blood stagnation. So that's basically the same thing as what he has, right?
So, should I do it that way better than the other way that I said before?
Yeah, it's better because it covers, there's two reasons. Why do we need qi and blood stagnation? Why do we need cold? Why do we need wind cold and why do we need chi and blood stagnation? Chi and blood stagnation because when we press on it, the pain is worse, which is not normally the case with wind cold. All right. Second, because of the onset related to the sleeping position. And if we're actually making the diagnosis of neck sprain, it actually should be chi and blood stagnation, because this is not common cold. Okay, why do we need wind cold as part of it? Well, look at the treatment plan. Treatment plan actually is very, very similar, right? To what some of the points are similar to what we would use for wind cold. Specifically, look at the herbal prescription. If you know herbs, this is a wind cold releasing formula. Okay, and so this is part of why that is important as part of the diagnosis. So there's no explanation, it looks here. Actually, there's no explanation for the points here. So why are we using Hoshi or small intestine 3 in this case? Taiyang, right, opens the Dumai. Okay, important point. Why is he using gallbladder 39?
Because
tendons. No?
No, for the muscle.
34. That's 34.
For the muscle.
That's 34. That's gallbladder 34. Why is he using gallbladder 39? Bone marrow. That is an influential point for bone marrow.
But for the tendons and bones, you part from the gallbladder.
Gallbladder 39, gallbladder 39 we think more of as being an important point for bone marrow rather than tendons.
So for tendons and bones, you part from the gallbladder.
Okay. All right. I'm not gonna spend much time on that. Logen is an extra point specifically for this syndrome, right? So specifically for this illness, for Logen, right? It's similar to the name of the illness. Extra point here for the neck sprain, okay? GB20 and LI4. Are there any other points that you would think? And what other points did you guys choose and why? Bladder 60, that's a good point in my opinion. How would you explain the function of bladder 60 as it pertains to this case? How would you write that down? Why are you using it?
I'm using it for the
Okay. Is that like a tradition we say master point? It influences the upper Taiyang. Yeah. I might phrase it as it dredges the Taiyang channel, or something like that, or clears the stagnation from the upper Taiyang. Yeah, and can be used for stiff neck. Yeah, a couple of those distal UB points are useful. 60 or 50, 8 can also be used, or something like that. LI15 is really a shoulder. If, because it says that the neck, like, the LI channel kind of comes down here. Sometimes if we really said it was LI channel rather than, like I said, it's probably more related to the Taiyang. So I'd be more inclined to use other points on the small intestine or gallbladder. Yeah, I wouldn't normally think of using 15 here. Yeah, Asha point. I mean, that's what he has written. Asha points. So there's what's what's the extra point here in the middle of the neck? Bilau, yeah. Yeah, you know, there's, we often use that for the neck spasm. Huatojiaji could be looked at. Do 16 maybe. It wouldn't be the first thing that I thought of, but, and then we may, some other things that we're maybe not considering, Gushu, if we're saying qi and blood stagnation, Gushu is not a bad point to use in these cases, especially because it is on the Taiyang, moves blood, and it's also, you know, from a clinical perspective, part of the trapezius, which often is seized with this neck pain, you know, it's still on there, and it still helps release it. So often this pain and tightness is going down into the upper back. We know that. Oh, sorry, UB17. We may also, you know, urinary bladder 10, right, instead of GB20 is a possibility here. Okay. Any questions? All right, you guys want to take a short break now? Okay. All righty. Okay, so case study 6. Get organized here. Okay, there we go. Joint pain in the hands. Patient had rheumatoid arthritis in the joints of the hand for 1 year. Okay, chronic, in my mind, 1 year. Chronic. Second thing I think, rheumatoid arthritis, B syndrome, dampness, wind and damp in the joints. That's what I'm thinking in my mind. When it started, she had a fever. Oh, immediately I'm thinking of possible heat, and the joints in her hands became painful, hot, and swollen. So this is, you know, heat B, but just in the back of my mind, I'm acknowledging that this is quote unquote when it started. So, you know, if they don't indicate a change, then I will still consider that as quite important, right? But you know, I know that they're saying when it started a year ago, it was wind heat B syndrome, right? Now they're saying currently, all right? Currently, her joints are swollen, heavy, and painful, and worse in humid weather. So now we have no heat symptoms. See the difference? Heavy and worse and humid means it's damp B, predominant damp B, not heat B. Okay? See the difference? There's heat, dampness, swelling, and a feeling of heaviness and worse in the humid weather. So, you know, in my assessment, because they're looking for your explanation, I can explain that. I can say that this was, you know, wind heat B syndrome that now has transformed into a damp B syndrome. You know, now I'm treating damp B, but I've explained all these other heat symptoms that she had. All right. Other symptoms include I'm not sure if that's supposed to be irregular period, because normally you wouldn't say regular period, but okay. Regular period with scanty blood, tingling legs, and eye floaters. What does that indicate to you? Blood deficiency, possibly of the liver, right? Because of the menstrual element here in the lower body, all right? Pale complexion indicates, or let's say pale complexion of the two patterns we've mentioned so far, pale complexion can be categorized as part of blood deficiency, okay? Tongue condition is pale, also can be categorized as blood deficiency. Weak pulse, now that's not the textbook version of a blood deficiency, nor damp B. Now this, in my mind at least, is the red herring, right? This is, you know, in clinically speaking, we can see a weak pulse in blood deficiency as well, but it's not the textbook version of the pulse here. So the question is, you know, I'm thinking in my mind, am I actually going to change my treatment plan or priority or principle based on that weak pulse? No. Right? The disease itself is what? B syndrome. So it's not rheumatoid. You don't have the authority, you don't have the scope of practice to diagnose rheumatoid arthritis. It's not, you're not legally allowed to make that diagnosis. Notice that's why they say in all the literature, TCM illness, okay? And we can kind of skirt around some of the biomedical diagnosis by using the TCM term that is more or less equivalent, but often the TCM term, so B syndrome is way broader than just rheumatoid. Rheumatoid tends to fall into that category, but B syndrome is much broader and includes rheumatoid as well as other types of arthritis and other types of painful obstruction. Which is B syndrome. That's the translation of B John. Yeah. Okay. And what is your syndrome differentiation here? What's the syndrome differentiation? I've already told you the answer. Is it damp heat?
No, wind damp.
Okay, wind damp. Where? Sweating? Swollen, yeah. Wind damp where? In the joints, we can say, specifically, I might even specify in the upper limbs. That's where she has all of it, right? And what else? No, where's the heat now? There's no heat now. It transformed from heat. It was heat. Now it's damp. Yeah, before it was heat. So it's not transforming into heat. This is, so what is the second pattern? What's a secondary pattern here? Of blood. Yeah. Okay. Diagnosis is Qi and, he says Qi and blood deficiency due to damp obstruction. All right. You could word that in a number of different ways. Damp B syndrome with blood deficiency of some form is the main things that I'm looking for. All right. Any questions on that one? What are 4 important points for this? Stomach 40? What's another one? Yes. Here I would use spleen 9. See? Phlegm, damp. All right. It's not quite so black and white, but it's helpful to think of it in this way for, simplifying your own learning. Okay. Spleen 9 is useful here. What else?
Spleen 6.
Spleen 6 we could use. Okay. What else? So this is an interesting, what are some good points that, these are all lower body points. What are some good points to use to address the chief complaint here? Sanjiao 3, possibly. Remember, it's the whole hand, so it's a little hard to narrow it down to these single points. But, there's also the extra points, right? Basya. This is actually what I often use, and I would also, possibly use Sanjiao 5 or something for, because it's a bigger point, so it spreads, and has some water transformation. Or you could use Sanjiao 4, also has the added benefit of tonifying the yuan qi. As yuan source point helps circulate qi and strengthen the qi a little bit more. Other points that we may want to consider, Li11 is a major point for obstruction in the arms, right? Li11 here. It's one of the points he chose. Do 14, because it is wind damp, we can release exterior wind a bit, right? Nov.28.2015. Bladder 17, he also uses. Bladder 17, Gushu, both tonifies blood here, also moves qi in the upper limbs a little bit, dispersing a little bit. Stomach 36 could use numbness in the legs, right? Does it say numbness or tingling or something like that? Tingling, right? So, yeah, some benefit there. Li, he doesn't have Li4 listed, but certainly you could use it. I mean, if you say Bhashya, one of the Bhashya is Li4, so, that's why I like that one. Yeah. So liver 3 has some liver nourishing, we often, it's yuan source point, so when it's blood deficiency, sometimes we see that. It also has a benefit to moving. It's not the most important organ that I'm thinking of right now. Some of the other basic points to move blood and tonify blood are probably enough. You see the major, the same idea though as I'm trying to stick by is I want points that dispel wind damp, points that address the chief complaint, and points that address this. In this case, I want points that address the secondary pattern of blood deficiency because that is likely to aggravate the symptoms and be tied in with them. So I do want to include some treatment for nourishing blood. Dispel wind damp. Yeah, dispel wind damp. Nourish blood. Yeah, those are the main things. Sorry? Spleen 9, yeah. The reason is because even though we don't have any major signs of what I would call internal dampness in this case, we don't have any digestive disorders or like a thick tongue coating or anything like that, we have to consider the treatment method. So how do we get dampness out of the body? There's really only like two ways. We either sweat it out, which is releasing exterior, or we drain it out. Yeah, so I'm trying to consider how am I getting this out. Spleen 9 is partially used for dampness because of its ability to kind of activate this part of the body, right? The yin meridians increase urination, drain dampness, and it has some spleen tonifying effect. You can't really just induce a lot of sweating in a case like arthritis. It's not actually going to get that type of dampness out. It's too deep. It's in the joints. It's when the dampness is in the skin we can do that. We can, induce diaphoresis. What's that? Moxibustion is great for these kinds of cases. Yeah. So you could include that in your treatment as well. You could write down moxa on XYZ point. Okay.
Well, I don't use moxa, but I use the lamp.
So then I would think about putting the heat lamp on the upper back in this case, which will warm and circulate the yang qi in the arms more, I don't know what spray moxa is. Is it warm?
And then they used to use that on.
Oh, okay, I see what you mean. Yeah. I mean, nothing's quite the same, all right? I mean, the heat lamps are decent because they're mineral, so it is a kind of a dry heat, but the cauterized, like mugwort, is drier. I mean, has a slightly different effect. So the other big difference that I find, this is really getting off topic and talking clinical practice, right? So the other big difference is that the heat lamp can't be used on points, it can only be used on areas. So they also have to go to ETD or something, they have like smaller electronic, where you can heat up a single point. In TCM, You use what you are able to use. So if you can't use Moxa, then use the heat lamp or use the other versions, and that's the best you can do. The herb itself has a medicinal effect, so adding the spray on, but I don't know if that's quite the same as burning the herb. Like it may have some benefit, but yeah. So you should never spray over needles.
No.
Okay, just saying. Well, you said you use needles and spray and put heat lamps, so just saying. Okay. We should spray, clean it with alcohol, basically wipe it off, and then we can, put the needles in. Anyways. All right, next case, and then we'll finish up for today. Case number 7, female, age 42. Chief complaint, diarrhea during menstruation. That's interesting to me. I mean, this is very common. Yeah. So, in terms of TCM pattern differentiation, it's interesting though, right? Because it's not something that you see in the textbooks. Bowels move regular except during her menstrual period where she suffers from loose or even watery bowel movement, okay? So I know in TCM, what are we thinking usually with loose and watery bowel movement? Okay, or damp heat, right? So Qi or Yang deficiency of the spleen or kidney, if I really try and be broad, or some form of dampness or damp heat accumulation, which would be more excessive type. And normally when we see watery, we think more deficient type if there's no pain or anything indicated, all right? She is thirsty. So what does that indicate? Possible heat present. Urgent urination, so she has frequent urination, so that could indicate what? Could it indicate damp accumulation, or it could indicate, not heat, urgent urination is different than scanty. So scanty is like you go and just a tiny little bit comes out. So with like UTIs, we sometimes have frequent scanty. Urgent really refers to more of a feeling of like, oh, I gotta go, right? As indicates to me more like a kidney, more like a deficient pattern, but okay. Insomnia or sleeping with many dreams, okay? We're thinking what? Shen and heart and likely related to either, again, heat in the heart, yin deficiency or blood deficiency. Perceiving heavy sensation of the two legs comparable to lead. Wow, okay, that's interesting. So what does that indicate to you? Could be dampness or deficiency. Blood deficiency? No. No. Recent profuse menses along with blood clots. Okay. Yeah, so okay. A red tongue with white coating and a wiry and fine pulse. Red tongue means heat. White coating indicates, well, we don't know. White coating is actually normal. Okay. Wiry pulse indicates what? Possible liver involvement. Okay. And fine indicates what? Of blood. Yeah. Normally we'd think blood. If it was fine and rapid, we would think yin, but at this point mostly we're thinking blood. So what is this pattern? It's tricky.
Blood deficiency, heat, also cold down.
Blood deficiency with liver cheese stagnation. Okay. Okay. This one's a little bit tricky.
She had a miscarriage?
Okay. So I'm just, if I objectively look at the signs and symptoms, I definitely see a little bit of heat. We see substantial heat signs and symptoms. So starting with, if I forget about this kind of diarrhea bit for a second, I see the thirst. I see, so now I'm reframing that urgent urination because of the other signs and symptoms. Maybe that it does mean frequent urination. Insomnia and sleeping agitation, okay? And then excessive menstrual bleeding, while we often think of what? What is a common cause of excessive menstrual bleeding? I said it earlier today, I think. Spleen not holding blood. We have diarrhea and we have excessive menstrual bleeding. So that, this is one possibility, but what is the other common cause of excessive menstrual bleeding? Would be heat, right? Heat will cause rampant movement of blood. So I'm really keeping both of those in mind. The pulse condition, wiry and fine. Wiry, possible liver involvement. Fine, damage to blood, we already said. The red tongue, so the red tongue, the thirst, urgent urination, difficulty sleeping, and excessive menstrual bleeding. So this is it's tricky here, but we definitely have heat present. We have to account for that. Is it true heat or is it empty heat? That's a good question. Again, I see no specific signs of empty heat. I don't. All right. I don't see any. The only thing that would lead me that it's possibly related to yin deficiency is the sleeping difficulties and the fact that she has lost a lot of blood because blood pertains to yin, and the fact that the pulse is fine, but they don't really confirm empty heat to me. Okay. The other thing that is because the symptoms are aggravated or present during menstruation also could indicate the liver involvement here. It also could indicate kidney though. Sorry? Liver depression is liver cheese stagnation. Same thing, right? So that's possible. All right. So we want to say let's go through this. We say that this is definitely internal. It's mixed excess and deficiency though. So if I had to choose between excess and deficiency, what would we choose? Excess. Interesting. Why?
Because of the heat.
Okay, it's a tricky one. I would have to go, if I just answer that question right now, I would have to say excess, but my reason is because there is a tongue coating. Everything else, and the pulse being wiry, shows the presence of an excess. There are definite deficient symptoms, though. The red tongue doesn't indicate excess or deficiency. The coating does. If it was red and peeled, it would be a deficient pattern. But because there is a coating on the tongue, It's difficult for me to say 100%, but I objectively would try to say that there's a little bit on the excess side with some signs of deficiency, but the deficiency is likely due to the excessive loss of both fluids from diarrhea and menstrual blood. Okay? The heat and cold, heat or cold? We knew that, okay? Is there a pathogen present? There's heat. Where is the heat? If I had to choose, so if we had to choose based on this, right? Yeah, where is the heat? Well, the best answer is probably the liver, isn't it? Or is it in the intestines?
Spleen.
Yeah?
In the large intestine.
You think it's heat in the large intestine. The problem is heat in the large intestine produces constipation, not diarrhea. It dries it out. If you say damp heat in the large intestine, that can cause diarrhea, but I would look for a yellow greasy coating. I would also look for bloating and distension, which we don't see. Okay, remember in the beginning I said diarrhea, damp heat, possible cause. Other causes, qi and yang deficiency is what we think of. It's not necessarily either of those. Illness is diarrhea, isn't it? Yeah, sure. That's the illness. Yeah. Okay. All right. The last vital substances. Are there signs and symptoms of any of the vital substances being affected? Putting you on the spot, I know. Is there involvement with qi or blood? Why blood? No, that doesn't show blood. That shows blood what? So wired pulse could show blood stagnation, but that's not what we have. What is being shown by the blood here? What's the other part of the pulse?
What is the question, sorry?
I said, what vital substances are being affected in this case? Blood what? Deficiency. What signs and symptoms indicate deficiency? I mean, I'm just verbalizing what you're expected to write. The fine pulse, okay?
Having a sensation.
The heavy sensation is that's a little bit interesting. That may be from blood deficiency, maybe not. Okay? Okay. So possible stagnation, but we don't have a whole lot. We do have indications that there's a loss of blood loss leading to some blood deficiency. That's what I would say. I see. Everything else, the sleeping with many dreams also, right? Could be related to that. Okay. Anything else we want to say here? So the illness is diarrhea, okay? And the syndrome differentiation, now you're going to have to bear with his description. Yin deficiency bringing heat tangled with water, disorder of metabolism, water and fluid flowing down large intestine resulting in diarrhea. Okay. Sometimes it needs to be. This is a little bit, to me, is a little bit stretching. So if I had to choose, what is the TCM pattern that is closer here?
I think it's a downpouring of the damp heat.
Okay.
It includes most of the symptoms. Discharging blood, different combinations.
Downward pouring of damp heat. Okay. I'm going to read his reason. And again, I checked with them. I think they're going to email you all of these answers so you can. I haven't been putting them all up on. Oh wait, I have these. I can put these up. Shoot, I should have done this earlier because whoever's watching this is not going to be happy. Okay, so here you read. All right. Thirst for drinking of heat, tangled with water, diarrhea, and heavy sensation of the two legs comparable to lead are because of damp heat accumulated in the large intestine. Okay, damp heat is being described as the main cause of the illness. So the question, we were able to, when we're looking at this, we're able to identify signs and symptoms associated with the blood deficiency. The patterns we could identify was blood deficiency, some liver involvement, although we couldn't really put our finger on it. We knew that there was heat present and there was a tongue coating, right? Okay. And this is a little bit of an interesting, take on the simple pattern, like the basic pattern. I would say you can't really have, it's difficult to put both of these down because they're two separate patterns, liver overacting on the spleen and damp heat in the lower jiao, all right? So, really we should try to separate, is this one or this one? Furthermore, I also expressed that I don't objectively see a lot of yin deficiency. I see damage to the yin. So it doesn't mean that I don't need to quote unquote preserve the yin or strengthen the yin, but I don't think that the heat, if you're saying damp heat, right, then I certainly wouldn't emphasize yin deficiency as being the primary, because most of the yin nourishing herbs will add dampness to the body. So in this case, I might switch that around a little bit. We do know that damp heat will easily damage the yin. So the fact that they have thirst, right, could, those little bits of heat signs, of yin deficient signs, the thirst and the agitation could be related to that. If it was my guess is I would attribute the insomnia to the blood deficiency, thirst to damp heat, urgent urination to damp heat. This is a little bit, again, ambiguous to me. Yeah. All right. Now, if I go further, and again, I like to look at the treatment plan and treatment principle. I'll actually go to the herbs because it's a little bit more telling than the points themselves are. Sorry. Here, this formula is really for, what is look at the function of the herbs within this. This really is for, there's not a lot of, this is for like a liver, right? So you see Chai Hu Bai Shao, right? Soothing liver, treating painful diarrhea, all right? And then a few herbs that are tonifying and damp. Okay, where is it? So for example, Dang Shen Bai Zhu are tonifying spleen qi a little bit, and Yi Ren drains damp. Chen Pi really moves stagnation, moves qi stagnation. So
It's a diarrhea during menstruation mainly is caused by hormonal changes. So why is it that we don't address the liver as the main thing for
it is. So that's what I'm suggesting, is that his wording is maybe not how I would. He does have most of the components in here, but if I look at the way he's treating it, it's not yin deficiency. I really don't think that you would address this as yin deficiency. It's really treating a liver stagnation and damp, there's a little bit of damp heat, but more, really more damp
because in this case, that's what I have for
stagnation.
illness. Because you really, in my opinion, as a Western, I would say the main thing is not diarrhea, it's the hormonal imbalance.
So, right, so here's the issue is that it's been happening for some time, and the yin deficiency, again, I think is caused by the loss of fluid and the excessive menstruation, loss of blood. So we do need to almost address that branch that symptom very strongly. If we focus on adjusting the hormones, it will take longer time to actually shift, which we do need to do. That may be the root of it. And then TCM, we may be looking at the liver pattern, but we do need to actually the treatment principle to what I would call astringe the diarrhea. I mean, we actually want to, he's using Roumet, for example, to kind of need to stop it now. All right. Does that make sense? Any questions? Yeah. All right. So it is 5 o'clock, and hey, thank you guys. Yeah. So I know it's a lot today. You'll have these to go over.